All right. We're going to be in here for a minute. We're going to be in here for a minute. So if you're tuning in and you're watching live, go ahead and hit the super chat, hit the like button, or hit the like button, then hit the super chat. Right? Hit the Cash App. I got to add my Zelle. You know, I got a Zelle now. Hold up. I got a Zelle now. Let me take this down so y'all can see me. I done got sophisticated. Okay? I got a Zelle. Right? So you can send me a Zelle now. ministerinky@gmail.com. You can use my email to send me a Zelle. I officially have a Zelle. Yeah. You can send me a Zelle. You know what I'm saying? So Tika keeps us, you know what I'm saying? She keeps our business together in the chat. Tika, you might have to start adding the Zelle to the you know what I'm saying? She puts all the ways you can support the movement. You may have to start adding a Zelle to that. You know what I'm saying? So yeah. I feel internet savvy. I feel internet savvy. Listen, we're gonna have a serious discussion though, right? So definitely get the support out the way. Like hit this if you haven't subscribed already, please slap your mother. No, I'm just kidding. But hit the subscribe button, turn on your notifications, right? Like the video. Yes, I got on my little active wear because I've been getting active. I'm trying to get my life together. Listen, I'm trying to get my life together. I was very disappointed in myself. Actually, that's a lie. I wasn't disappointed in myself. At first, I was very proud of myself, but then, you know, you start thinking of stuff over and over in your mind, and then you kind of just feel away later on. You know what I'm saying? So only being able to do 52 push-ups in 60 seconds, you know what I'm saying? At first, I was feeling proud of myself, you know what I'm saying? But I'm like, nah, bro. The summertime cannot catch me under 60. The summertime cannot catch me under 60. I need to get back to my 60 and 60. Now, mind you, for the people out there that are working on their 60 and 60s, when you're practicing, like when you're doing your daily exercise, attempt to do your 60 straight through, right? Just try to get you a set of 60 push-ups in. Like, if you can do that, you're good, right? But when you're timing yourself, you do not have to do a straight 60, right? Because a push-up, typically, if you're energized, you can do a push-up in less than 1 second. So you can blow through 20 to 30 push-ups, take you a breather, right? Get you a breather, get you 5 or 10 seconds worth of rest in there. And then, you know what I'm saying, then get back to, you know, trying to knock out that 60, right? The whole idea is just following, you know, 60 under 60. You know what I'm saying? So that's what it is. Okay, Peyton already. Let's go. Peyton already. Let's go for the Mother's Day live. Come on now. That's what I'm talking about. That's what I'm talking about. For the dads that have to be mothers and fathers. You know what I'm saying? Like, we got to represent for the dads out there. Now, listen. High blood pressure, right? High blood pressure. It's ingrained in the Black community's conscious that we are born with high blood pressure, right? So I'm a fan of mnemonics, right? Mnemonics has helped me to learn a great deal. So I try to use mnemonics all the time. And a mnemonic is simply something that can help you remember something, right? Something that can help you remember something. So for me, I find the greatest deal of help with remembering things is by attaching things we want to remember to things that we cannot forget. I want y'all to, right? Attach things that you want to remember to things that you can't forget, right? So now I'm almost 50, right? So that means I was born in the 70s, raised in the Bronx, right? So for us, like the Nation of Gods and Herbs and the 5% and you know, hip hop has spread far and wide, and it's become a lot of different things. It's transformed into a lot of different things. You know what I'm saying? But early on, hip hop was deeply intertwined with, you know, the 120, right? The 120. And so for me, the 120, that number 120 is a mnemonic device that I use to attach a lot of different stuff to, because I can't forget 120. You know what I'm saying? Not necessarily the supreme wisdom lessons or the you know, the specific, you know, memorization and repetition protocols of the Nation of Gods and Earth, but per se, just the number itself, the 120, like the number 120. You know what I'm saying? Like, that's in my mind, right? Primarily because it was like the first strong piece of science that I understood. Like, atoms had a maximum electron valence at, you know, like 120. Like, that was the most electrons an atom can carry. You know what I'm saying? So that was like, while the older gods was, you know, it was, you know, how many miles to the earth, and, you know, me, I was on atoms and electrons and whatever the case, right? So my point is, right, for some of you, that number 120 is ingrained in your mind, right? So for those of you who, you know, you have that number ingrained in your mind, I just want you to add, two pieces to it, right? Or maybe a few pieces to it, but we'll start with the main two pieces. You know what I'm saying? We gotta listen, man. High frequency in the building. Listen, y'all got to understand. That's listen. Peyton set the bar, and then high frequency coming in with the high frequency. Like, that's what I'm talking about. And it's nothing is written there. It's just high frequency. Just you know what I'm saying? Like, that's what I'm talking about right there. That's what I'm talking about right there. All right, so we're going to attempt to have us not. We're not going to attempt. We're going to pull off a nice little master class, right? We're going to drop some science. We're going to put a nice little master class together. Now, high blood pressure is the conversation, right? High blood pressure is the conversation. You know, the movement is melanin versus diabetes, right? That's the movement, melanin versus diabetes. And we've been able to change a lot of lives. You know, we still got a ways to go. So we definitely need support, but we try to raise awareness around all of the associated complications of diabetes, right? All of the associated complications. And so, I mean, there's at least we probably have written about high blood pressure in, you know, maybe 20 different books, maybe 30 different books, right? We have a couple of primary books that, if this information is interesting to you, I want you to get these books, right? I want you to get these books, right? So we're just going to highlight these books at the outset. Then, you know, as we go through, y'all know how I do. I'll mention the books, but just in case we don't get through everything, right? Because I want to review a kind of a long video, right? It's kind of a long video. So we may be here for a while tonight. You know what I'm saying? We may be here for a while. That's why I started, you know, right after 6 o'clock prayer, right? Because we may be here 3, 4, 5, but you know, we may put in some work tonight, right? So I don't know exactly the twist and the you know where tonight's combo is going to take us. I know that we're going to thoroughly be exploring high blood pressure. Now, the reason why the conversation is so important, right? Not because it sits in between diabetes and kidney failure, or diabetes and heart failure, or even diabetes and brain failure, right? That is a thing. Brain failure is a thing. Like, you're like, nope, that's not a thing. We never heard that before. Yes, you have, right? Dementia is brain failure. If you can't remember who your children are, who your husband or wife is, that is brain failure, right? So we don't necessarily use the term. We use Parkinson's or dementia or Alzheimer's, primarily dementia, you know what I'm saying? But high blood pressure is the silent instigator. That's what we used to call them in the neighborhood. You know what I'm saying? The instigator, the person that's starting the problem, but then they kind of ease out the way and let the drama pop off. High blood pressure is the primary instigator, right? Of a lot of these issues that are, you know, killing folks. And the crazy thing about high blood pressure is it doesn't have symptoms. It doesn't really have symptoms like, you know, like heart palpitations, or maybe you think you got a pain in your chest or something. Like 9 out of 10 times, those are not high blood pressure symptoms. Like that's, you know, maybe your sympathetic nervous system, or maybe you just got some bad trees, or, you know, it could be anything. Maybe you need to belch, you gassy, or, you know, it could be, but high blood pressure doesn't have symptoms. So a lot of times, you know, especially depending on the culture you come from, you know what I'm saying? Black folks, Spanish folks from the neighborhood, we typically don't go to the hospital. We go to the emergency room. So if you're not, you know, on top of checking out, you know, like getting diagnostic work, you know, like you won't know you have high blood pressure until you're experiencing dementia, spinal problems, you know, heart failure, kidney failure, something to that extent. You know what I'm saying? So at that point, you know, like people running around, like people running around telling folks, yo, all you got to do is take some sea moss. Oh my goodness. I promise you, at that point, when you get cancer or you experience in some degree of heart failure, or, you know, like a detox or, you know, a package of sea moss is not, like, that's not it. You know, my people are dying for lack of knowledge, right? That's what you need, is education. I have brung people back from the brink of death more time, like, but with information, with knowledge. You know what I'm saying? I'm gonna put a book in your hand before I do put anything else in your hand. That's why we're dying out here, is because we don't have knowledge. So, the Constitution, right? This is the Constitution book. If you don't have this book, go to Amazon, add the Constitution to your cart, right? If you don't have the Pumping Iron book, go to Amazon, add the Pumping Iron book to your cart, right? Don't worry, we're gonna come back to the 120 thing in a second, right? If you don't have Eber's Papyrus, Volume 5, right? We have a few of these, but Volume 5, actually, not even Volume 5. Or do you need both? You might need Volume 5 too. I'm trying to keep your book budget. Okay, you know what? You may not need, don't worry about but glaucoma's in here. Yeah, see, glaucoma's in here, and glaucoma is high blood pressure of the eyes. So yeah, I knew I had this here for a reason. All right, so Eber's Papyrus, Volume 5. Melanin versus Diabetes, the Kidneys book, right? All of these books you're going to need to really fully understand this high blood pressure thing, right? The Kitchen Chemistry book, right? You're going to need the Kitchen Chemistry book for sure. Everybody should have the Kitchen Chemistry book for no matter what. Period. If you have ever watched a Dr. Inky video, you need to have this. Like, you have to have the Kitchen Chemistry book. Period. Okay, Eber's Papyrus, Volume 6. Pressure bust pipes. You have to have that. This is a primary text for hypertension and some related issues. And then cardiochemistry, right? The cardiochemistry book. I definitely want you to have these books, right? It's a few more though. It's actually a few, because, you know, high blood pressure, man. It's one of those. It's one of my pet peeves. You know what I'm saying? Like, I got issues. You know what I'm saying? I got trauma. Being dark skinned my whole life. You know what I'm saying? Being born in the 70s and being dark skinned, I got issues. And if not for those issues, I wouldn't be here in front of you guys. So obviously, you know, God doesn't make any mistakes. You know what I'm saying? But yeah, I definitely have, you know, pet peeves and high blood pressure, diabetes. You know, folks saying that just because I'm dark skinned, I have to, like, I chances are I'm going to die from complications of high blood pressure and diabetes, even before even before you can walk. That's already written. You know, insurance companies and things like that, they're already calculating these into your death. You know what I'm saying? So going back to that 120, right? Going back to that 120, what I want you to add to that 120, right? I want you to add 120 milligrams per deciliter, right? 120 milligrams per deciliter, right? Because I think that Black people as a whole, if while, back in the days when folks was really taking, learning 120 serious, if they would have included these two things, we'd be in a whole different place. You know what I'm saying? Not just Black folks, but people in general, because high blood pressure is killing everybody, right? It's just everybody doesn't get that prognosis at birth. Like you're going to die from, you're going to die from high blood pressure or diabetes, a complication of high blood pressure or diabetes. But 120 milligrams per deciliter is the turning point in your blood sugar, right? It's roughly equivalent to what a 6 A1C would be, right? So at 120 milligrams per deciliter, they say you're becoming diabetic or you're entering into pre-diabetes, right? And then the other part is 120 milliliters of mercury. Yeah, milliliters or millimeters rather of mercury, right? Most people don't know that's what that's for, the mmHg, right? So when you look up high blood pressure, it says 120 mmHg. That's millimeters of mercury, right? The Hg is mercury, the mm is millimeters, right? So 120 is that number that you need to know for diabetes and high blood pressure, right? So work on that. Add that to the memory bank. We want to make a deposit into your memory bank, right? Deposit that into your memory bank, right? 120, right? 120 millimeters of mercury, right? Your systolic number, right? You get the systolic over the diastolic number. The systolic number is the main number to watch out for. The systolic number goes over 120. You need to be alarmed, right? You're not going to drop dead, but you need to be alarmed, right? You need to work on, some things. And we have some things in these books and some things we're going to discuss tonight that'll help you, make some adjustments. Now, the reason we're having this conversation tonight is because it's been brought to my attention. Well, it's been brought to my attention that we need to discuss the conversation, right? But it's also been brought to my attention that European doctors, right, we're going to look at one tonight, have now started making their rounds saying that high blood pressure is fraud, right? And not necessarily that high blood pressure is not a real thing, right? Because high blood pressure is killing a lot of folks, right? But the way it's been taught to people, the way people have been taught to care for themselves, some of the ideas surrounding high blood pressure. And so those concepts have been floating around in the holistic community for decades. For decades, they've been floating around in the holistic community, but people have been, brushing them off. Holistic doctors, holistic practitioners are not real doctors, right? Or naturopathic doctors such as myself, they say, oh, you're not a real doctor because you can't prescribe medicine. So now, though, the conversation is changing, and it's just funny to me that, I ain't gonna say funny, right? But the thing is, this is why I say Hosea 4 and 6. People are dying for lack of knowledge. And my favorite part of that Bible quote is not people are dying for lack of knowledge. It's the part that comes after. Because people that don't even read the Bible, they've heard that before. Hosea 4:6, my people are dying for lack of knowledge. But you have to keep reading because the next part is the most important part. And it says because, and I'm paraphrasing, but it says because people reject knowledge when it's given to them. So it's not that people don't have knowledge because they haven't been exposed. It's not that people don't have knowledge because it's being kept secret. It's because people are rejecting knowledge when it's presented to them. And a lot of times in our society, people do that based on who's presenting the information, right? We have preferences on how we like to receive information. And so, over my, I guess almost 20 years at this, I noticed there's a correlation, an inverse relationship between emergency level, emergency level, and preferences, right? When people feel like they at a low emergency level, they have a lot of preferences, based on their religion, their social standing, how much money they make versus how much money you might be making, and all kinds of different stuff. As the emergency level increases, you'd be surprised how open-minded people become. So we want to explore as much as we can tonight, because high blood pressure is a killer. There's a lot of misinformation out there. There are a lot of people that just aren't educated about high blood pressure or hypertension at all. And, it's like the Phantom of the Opera. It's the invisible bully, like the gooch. You know what I'm saying? Like it's complicated because it has no symptoms, and it'll make you lose your eyesight. Right? High blood pressure will stop your eyes from working. High blood pressure will take your brain away from you. High blood pressure will take your heart away from you. High blood pressure will take your spine away from you. Like literally your spine will you'll start to rupture disc and all kinds of high blood pressure, right? High blood pressure will take your kidneys away from you. You know what I'm saying? So, high blood pressure can even create diabetes, right? High blood pressure can not only be caused by diabetes, but what many people don't know is that high blood pressure can create diabetes, right? So you can get high blood pressure, right? Or you can build high blood pressure, and staying in a high blood pressure, state, especially unchecked, can cause your body, right, to create some diabetic conditions, and then those unchecked, they just you got diabetes, you know what I'm saying? And so there's a very intimate relationship between diabetes and high blood pressure. And diabetes or high blood pressure can cause your kidneys to fail, heart to fail, brain, blah, 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 blah. But when they team up, I'm sure y'all saw the movie Sinners, right? High blood pressure and diabetes like the twins. You know what I'm saying? Like every neighborhood got a pair of hood twins. Like, yo, twin, yeah. High blood pressure and diabetes, twins. You know what I'm saying? So, yeah, let's get to, man, I don't even know where to start. Let's just go to the doctor and see what she's talking about. Let's catch a vibe. right? Let's just catch a vibe because this was so it. I could just hear like when I watched this video, and I only seen a clip. You know what I'm saying? As soon as I seen it, I was like, oh, okay, I gotta review this with the family. You know what I'm saying? So I saw a clip, but immediately in the back of my mind, I started to hear that song. It's been a long time coming, long time coming, but I know a change gonna come. like theme music, you know what I'm saying? I'm like, oh wow, so is this a medical doctor? Is this a medical doctor saying this now? Oh, oh, let's go, God, get busy. God is working, and listen, it's because of social media. So don't get it twisted. Social media has brought out the worst in people, but social media brings out the best also, right? Because there's such a fluid information highway, and people steal intellectual property so crazy and try to make a name for themselves or whatever the case. I'm almost 1,000% sure, like she didn't make this up. She saw this on some smaller platforms, probably, our stuff, but when she put it out there, it went, and now all of a sudden, major institutions and mainstream platforms are now having this conversation that's an old conversation in our community, right? But it's important because as people move on, right? As people move on, and in fact, maybe we should go to kitchen chemistry. Maybe we should go to kitchen chemistry because in the kitchen chemistry book, right? Maybe I'll save it, but I'll just say in the kitchen chemistry book on page 182, we have a small little kidney section, right? We have a small little chapter on the kidneys. And the reason why we have that in this book is because a lot of people go to the internet for information, right? The same way people are going to artificial intelligence, Chat GPT and these platforms for information, right? But Chat GPT is nothing but Google on steroids, right? And so what you have to understand is, and Google is nothing but divination. It's digital divination, right? I just want you to understand that. So the point that I want to make here, though, is the question you ask is everything. So if you don't know what to ask, even having the strongest AI, whatever, at your fingertips is not going to help you. It's going to get you in more trouble. Case in point. The reason why we have the kidney section in the kidney section in the kitchen chemistry book, right? That's kind of like a tongue twist, is because a lot of people, they go to YouTube for health, right? They go into YouTube for health. And when you go to YouTube for health, health is primarily driven by bodybuilders on the internet. It's not driven by people trying to obtain longevity. It's driven by bodybuilders. So, 90%, 99% of the conversation is about how carbs are the food from hell, avoid carbs at all costs. Right? The great majority of the online health conversation is driven by paleo or keto or high protein conversations. And while those things do have a place in your health, right, depending on what your body is like and what your goals are, a lot of people are dying watching these watching YouTube videos when they don't know what they're looking for. This is why we stress reading. We stress books, reading. Because even if I put a book in your hand and you start reading, every time you come up to something that you're not sure about, that you don't understand, even if it's just a word or a term, you got to look it up. And you start to build your knowledge in your database. So by the time you actually really go through a book cover to cover, you've learned more than just what I put in the book, because you got to research so much of what you come across in the book, right? And even if you challenge some of the stuff in the books or whatever the case is, that's what it's for, to grow your mind, to grow your knowledge around specific subjects. And what people need to understand is that if you have diabetes, if you have kidney issues, if you have high blood pressure, if you have brain issues, memory issues, dementia, and you go on a no carb diet, you might be committing suicide. You might be killing yourself. you don't know. You might be killing yourself. So you might be, stage 1, stage 2 kidney failure, where you can still turn that thing around relatively easy. You go on the internet and you see some muscular dude and you automatically equate muscles with health. And so he talking about, yeah, I'm eating 180 grams of protein a day and I haven't had a carb in 6 months. And, all right. So now you done went to the supermarket and got, chicken breast and, all right. Not knowing that those are the things that put the highest amount of stress on your kidneys. Not knowing that those are the things that put the highest amount of stress on your blood pressure, which is one of the reasons why bodybuilders, they prefer that type of diet, because they say, well, when you're eating animal protein, it has the highest thermogenic value, right? That means it costs your body the most calories to metabolize those types of food. Why? Because those foods are hard to digest. So they're making up for the fact that animal foods don't have fiber in it with, like, they're not really making up, but in their mind, they're making up, like, you know what I'm saying? But if you have anything related to high blood pressure, that's absolutely the opposite of what you need to be doing. So don't be just half-cocked jumping on the internet thinking I'm about to watch Andrew Huberman and we going, no. You have to build your database. You have to make a whole bunch of deposits in the memory bank. You know what I'm saying? Until you are, and like I used to work on Wall Street, right? And there was a certain amount of money that you needed to have to be qualified to make certain types of investments, right? And so that kind of philosophy applies here. Like you got to save up. You got to make some small deposits in the memory bank before you're even considered an accredited investor. Yeah, you're not an accredited investor because you got $300-400. Like that's, yeah, you got to have, you got to be in the game. You know what I'm saying? So we want to, let's take a look at this. And then I just want to show y'all this before we even play it, so you can find it on your own later on, right? Later on, you can find it on your own, right? This is her, right? This is what we're going to review, right? This is what we're going to review.
otherwise we're just considering.
Congratulations, you just spent 1 week making.
Okay, you know they're gonna hit us with some ads.
Hello, everybody. It is Tuesday live here at the Dr. Boz Show. Thank you for joining me for what I hope you see is one of the biggest scams that I have been duped by. And we are going to explain that story tonight. Definitely been a difficult cognitive dissonance for me. Like, I've been teaching about blood pressure for the better part of 25 years. And as I slowed down to review something, I just feel a little unsettled. We have a great show for you tonight. I do want to say a big shout out to those who are in their second week after the 21-day course. We have several success stories, and I recently read your reviews of the course, and just I opened my pin chaser meeting this morning with my show tonight is going to cause some fuss. There's going to be a little controversy. Let's get right into it, because I think you're going to want to hear these more than you want to hear my announcements. So here we go. All right. So the question that I am focused on, and what really has had my attention over the last several weeks, is should I be treating blood pressure to less than 120 over 80? This question has been on my mind and just part of my practice. And it became even more of the questions we got in emails and from even people in the 21-day class when I posted this video about 6 months ago reviewing blood pressure and why you do need to get blood pressure down, and that the best way to do that is not to lower the salt. So this video's had over 1.5 million. That is not to lower the salt. So this video's had over and that the best way to do that is not to lower the salt. So
Yeah. So there's that part, right? There's that part. I'm not saying it. Dr. Boz is saying it. Now, I will say, this has been something that we've been stressing for over a decade, right? Sodium. So your body works. So ma'at, the Kemetic principle of ma'at, right? The Kemetic principle of ma'at was distorted, right? It was distorted into this phrase, all things in moderation, right? All things in moderation is baloney, right? Never let anybody slip that, don't. That's absolutely, ask them, is it okay? If anybody tells you all things in moderation, ask them to use a little bit of heroin. Ask them to drink a little bit of straight bleach out of the bottle. You know what I'm saying? There's no such thing as all things are good in moderation, right? But it stems from the distortion of the concept of ma'at, or balance, right? And that's how the body works. The body works in balance. Biochemistry is about balance. Redox is about balance. Electricity in the body is electricity in your body is just as important as protonicity, right? That's a new term that people are going to start hearing more and more about, right? Basically, electricity, a flow of electrons, right? Protonicity is a flow of protons, right? And so those things are equally as important. In fact, in your mitochondria, in your electron transport chain, where we're most familiar with the flow of electrons, the flow of electrons is only important because it creates a flow of protons. and it moves protons from the inner matrix to the outer matrix, and then allows them to, power ATP recycling, right? So just understand the concept that your biochemistry is based on balance and ratios, right? So sodium is not necessarily a bad guy, right? Now I'm making a distinction between table salt and sodium, but sodium is not a bad guy, right? The problem with sodium is that we're not getting enough potassium, right? So it's not about the sodium as much as we don't have the right ratio of potassium to balance it. So when you eat natural food, typically you're going to have 2 to 7 times as much potassium as sodium in those foods. When you eat processed food, you're going to have 2 to 4 times as much sodium as potassium. And then people add salt to it, which makes it go even crazier, right? Right? Because the food is already upside down, ratio wise, and then you don't went crazier, right? So, and if you notice, anybody that's went to school for it, or anybody who's had kidney problems or whatever the case may be, those are the ops in terms of how you balance, your kidney, sodium on one side, potassium on the other side. So, she's starting right out the gate with fireworks.
Well, this video's had over 1.5 million views in 6 months. We see the popularity of wanting to understand this, and during that education about not using salt, I referred to a very popular study that came out in 2015 called the SPRINT trial in the New England Journal of Medicine. Very much a part of like the foundation for treating blood pressure. And their conclusions were that among patients with high risk for cardiovascular events, but without diabetes, the targeting of blood pressure, the top number, should be less than 120. And it should be compared as compared to the 140 we used to be saying. And they also stated that it resulted in lower rates of major heart death, significant more adverse events. Okay, so it said, yeah, we should be lowering this blood pressure even further. But I want you to pause. I want you to pause and think with me on a few things, because this history lesson of hypertension might sound boring, but I guarantee when you see what I've witnessed as a physician and as an assistant professor teaching med students about how do we think about blood pressure, why do we think this way about blood pressure, and where did it come from? Where are these rules coming from? That you're going to have a little more grace for your physician. At least I hope you will. Because I'm not trying to get them in trouble, but I am here to say we have some blood pressure rules that I think you're going to see we should have been a little.
I guess that was God right there telling me we needed a break. Yeah, they just came out of nowhere and jumped off the top rope with that promo right there. Now, there is a lot of different facets to some of these conditions, right? So I'm gonna need you to kind of understand the difference between like a condition per se and like a symptom. Right? A symptom and a condition, and then some of these like phantom illnesses, right? So for instance, Alzheimer's disease is a specific condition, and it has a set locked in group of symptoms, right? Parkinson's disease, set locked in group of symptoms, right? Dementia, dementia is not a set thing. Dementia is not really a thing. Dementia is one of those phantoms of the opera, like high blood pressure. Dementia is a phantom of the opera, right? There's a laundry list. There's thousands. There's an infinite amount of things that can cause you to have dementia, even though we have the usual suspects, the top 3 or 4 things that usually cause dementia. Dementia can be caused by a bunch of different things, right? High blood pressure fits into that space. High blood pressure fits into that space. Type 2 diabetes fits into that space. This is the reason why people don't die from type 2 diabetes, right? They die from complications associated with having type 2 diabetes, right? People don't die from high blood pressure. They die from complications of high blood pressure, right? So you got to understand that there's a lot of different ways. And that's the importance. That's why we're reviewing the doctor's work and her commentary, because whether we agree with her 100% or not, right? What she's doing is she's opening up the mainstream ideology to expand, their thinking, right? Because we go as far in our research to even associate high blood pressure with poor nerve function, you know, poor nutrition in terms of lack of vitamin K, right? Poor internal muscle development, right? All of those things can cause you to have high blood pressure, and those don't have anything to do with salt, right? Those don't have anything to do with salt. And the reason why I say, just so that we're expanding, we're building, right? The reason why I say that nerves can have an issue with high blood pressure, it's not like how my mom used to say, I got bad nerves. You know what I'm saying? Like that. No. Your larger arteries, right, are made out of muscle. And those muscles have to be connected by nerves back to your spine and to your brain. And so if you have poor connection with the nerves, right, you'll have a situation where you'll be getting the wrong signals to your arteries and vessels at the wrong time, because timing is everything, right? So there's a time when your vessels need to dilate. There's a time when your vessels need to constrict. So if when they should be constricting, they're dilating, problem. If they should be, dilating and they're constricting, problem. That's going to put abnormal amounts of pressure, right, on your circulatory system. What's the second thing we say? Oh, hardening, right? Or losing the elasticity, right? Or we said the vitamin K. So if you have bone morphogenic protein dumping calcium into the circulatory system, and you start to have hardening of the vessels, they're not going to be able to stretch. They're not going to be as elastic. As they lose that elasticness, the pressure is going to increase. The harder your arteries and your vessels overall get, the higher the pressure goes, right? And it's not necessarily because, it doesn't have to do with salt. You know what I'm saying? Just to open your mind up. You know what I'm saying? That's just a few things off the top. Like that's just a few things off the top to open your mind up so you can see that there's a lot that goes on, right? But you have to remember that your vessels open and close, open and close, open and close, right? So if those signals to open and close are not, and that's going to cause blood pressure in and of itself, and that's not going to have anything to do with sodium. right? So there are some sodium related issues, and I'm sure she's going to get to them. If not, we will. If she doesn't get to them, we will get to them. You know what I'm saying? But I just want you to understand that everything high blood pressure related is not salt or sodium. You know what I'm saying? And if that's your background, that's a large part of the reason there's so much misinformation floating around. Because if the only boogeyman you're looking for is salt, if that's the only thing you're looking out for, something else is going to get you. Something else is going to get you, right? Something else is going to get you. So you need to know all of the different variables that can, that can get you.
Who's what I like to call the shiny shoes, JNC, Joint National Committee. These are the folks that show up with ties, usually gray hair and shiny shoes in Washington, D.C., and they help primary care physicians like me say, what are the rules? I know there's a lot of people doing research out there. There's a lot of studies out there, but as a like, get to the punchline. What am I supposed to do about blood pressure? What's the right rule? And when you look at this shiny shoe committee, the folks who are very cerebral, and they get together and they come up with the rules that physicians are supposed to follow. And we take tests to say, did you follow the rules? We teach on an academic. When we look at accreditations for medical schools, it's, are you teaching the guidelines? Are you following evidence-based medicine? So you're going to see here that.
Keep in mind, remember, that term evidence-based medicine is only like 20 to 30 years, maybe 30 years old. Yeah, that's a newly invented terminology. So every time that pops up, I like to remind folks that what were they doing before evidence-based medicine? If you've just been doing evidence-based medicine, which means you're prescribing and practicing medicine based on the evidence, the experimental and experiential data, right? What were you doing before that, right? In the neighborhood, we call it freestyling, but we'll let her continue.
The first set of rules happened when I was 6 years old in 1977. And they have, should you consider treating the patient, or should you actually write a prescription and treat the patient? Again, at first they just focused on the bottom number, or that diastolic number. And then the rules change in 1980, and they say, okay, we can see that if you're in your elder years and it's greater than 160, we're gonna put those rules for. But otherwise, we're just considering treatment when that bottom number, when that diastolic number is greater than 90. But we think we should treat you if you have that bottom number greater than 150. If you have kidney disease, we're going to treat you at 90. And then if you're old, if you're over 60, that's what they used for old. I didn't come up with that word. Then we're going to treat you at 90 as well. This continues on through the years. 1984, then another set of shiny shoes. 1988, 1993. I want you to notice that this 4-year interval is not an accident. This is a very political assignment that these shiny shoes end up on this committee. I want to zero in on JNC7. I remember JNC7 because I was in practice and I was just getting all right, I work for a corporation. I knew that I was getting paid on, did you hit the guidelines? Did your patients hit the guidelines? We called it pay for performance. And the better you were at controlling the patient's blood pressure relative to the guidelines, well, you got paid a few more pennies. Really, what was the motivating factor for me and many physicians was you had bragging rights in the locker room. When you were looking at what is your rank against other physicians in the area, how well did you control blood pressure? And these guidelines were used to set the rules. So at this point, they said, yeah, the general population should be treated when the top number is greater than 140. And if you had diabetes or kidney disease, we're going to treat you if the top number is greater than 130. And if you're elderly, yeah, we'll teach at 140. Again, 90, 80, and 80 were the rules for those same populations for the bottom number, that diastolic number. The kidney group had a different set of rules that came out in 2012. You have JNC 8 coming out in 2014. And then you have the American College of Cardiologists in 2017, American Heart Association coming out with even more complicated, like, okay, we want these people to have their blood pressure less than 140. These people are treated at less than 130, another 130, 30, 90, 80, 80. Again, the rules kept changing. And I think it's entertaining to notice that when you look at what the Europeans did, they said, you know, you Americans are really noisy in making your rules, and we're going to come up with our own set of rules. So in 2007, which is right on either side of a couple of those guidelines from the let me see here. I'm going to push here. I need to push that to, I think I can. Hold on just one second. Yeah, I'm just going to move my head to the side here. So when looking at this, they said, you know what? We as the British have a much simpler plan. This was their simpler plan. That if they had no risk factors, if they have 1 to 2 risk factors, if they have 3 or more risk factors, if they're diabetic, if they're established cardiovascular renal disease, this is really going to matter when you get to the end of this lecture. So just remember, these were the people with the simple rules, that this would be considered normal. This is high blood pressure. This is grade 1 blood pressure. Again, they've got risk for when you change, everybody starts with lifestyle on every single one of these outcomes. Here's how you improve blood pressure. Start with lifestyle, and then you start adding certain types of drugs and relative. I mean, what my point is, was not simpler. This was not easier. It was just as messy as the other people with the guidelines. And it brings me back to what's the answer? What should be done when lowering someone's blood pressure? We have no argument that a high blood pressure is the number 1 cause of death in the world. But how low should I make it? How low do you treat it? All right, so we are going to talk about something that I teach every medical student to talk and make it. How low do I in the world? That a high blood pressure is the number 1 cause of death in the world. A high blood pressure is the number 1 cause of death in the world. A high blood pressure is the number 1 cause of death in the world.
So I know some of y'all get bored. I know some of y'all get bored, especially in the world where, Papoose and Remy Ma, they beefing on the internet. Diddy is in trial, Cassie and Wendy Williams and NBA playoffs and so many different entertaining, right? So many entertaining, Charleston White and Whack one, there's so many different distractions, right? So many different distractions. I know that when it comes to a certain type of information, it may be hard for you to focus. It may be hard for you to focus in, but you need to hear what she's saying, even the boring parts. Even the boring parts, because I'm not a medical doctor. You're not a medical doctor, right? So listening to the evolution of how institutionalized medicine is teaching young doctors to address high blood pressure, because here's what you may not understand. Tomorrow's doctors are still in middle school. Tomorrow's doctors are in grade school right now, right? So when you go to the hospital, if you go to the hospital today, you're not dealing with tomorrow's doctors. You're not even dealing with today's doctors, because today's doctors are still in medical school. They're still in college. You go to the hospital today, you're actually dealing with the doctors from the 80s and the 90s and the early 2000s. That's who's running the hospitals right now. So these outdated modes of treatment that she's talking about, you need to have this knowledge so that when you sitting in there and they telling it to you, you need to be able to recognize this right out the gate. Or maybe they telling this to your wife or your husband, or maybe you in there sitting in there with your mom or your dad or your uncle, auntie is it, uncle is it, you need to be able to recognize this and go, okay, we're gonna get a second opinion. We're gonna get a second opinion. You know what I'm saying? Or we'll incorporate that into, but we may not fully, right? You just need to have all the, because in my health journey, one of the big things I learned was poverty, right? Poverty limits us, right? When you don't have, you're constantly faced with, this or that, right? This or that. When you're a child and money is tight, you want a pair of sneakers, you want some Jordans, and you also wanted a video game, right? But you're not getting sneakers and a video game. You're getting sneakers or a video game, right? You got to make a choice. Whereas households where folks got money, money's not an issue. You might be able to get the game, accessories for the game, sneakers, outfit to go with the sneakers, you know what I'm saying? Hat, jacket to match, you know what I'm saying? As adults, we still carrying that same thing and we're not able to recognize it, right? When it comes to your health, you're going natural or you're going medicine. You're going medicine or you're going surgery. You're going vegan or you're going keto. You're going, right? People with money, people with access, people with knowledge are not doing this or that. They're putting together the best of everything available so that they can get well. Because at the end of the day, that's all that matters, right? That's all that matters. And so while we was listening to Dr. Boz doing her thing, I said, let me go ahead and write down this chart. This is the simple chart that's in the kitchen chemistry book, right? This chart. Now, obviously, there's a lot more details in the kitchen chemistry book, but I wanted to write this down because this is how diets specifically affect the kidneys. This is not the rest of your body. This is just how they impact the kidneys, right? And this number tells you how hard the food impacts the kidneys, how rough the food is on the kidneys. So fish is the worst offender. And I know a lot of people, when they start to eating better, they like to highlight fish. Like, oh yeah, well, I stopped eating red meat. I stopped eating red meat. I'm just on fish right now. Yeah, I'm on that pescatarian. I'm just doing fish and vegetables right now. Yeah. Okay. So just so you and I know, you just doing fish right now. Okay. Well, you just destroying your kidneys right now. That's, yeah, we just so me and you on the same page. If you one of them, I'm just doing fish right now, people. You just destroying your kidneys right now. So just so we on the same page, right? Now we've been know about pork is crazy, right? Pork is a runner-up. We've been know about chicken, right? But cheese, right? Eggs, and this country has recently gone through an egg revolution. And in some spots, right, depending on what you got going on, depending on your budget, eggs might be good for you. Eggs might be good for you, right? But for your kidneys, right? Just saying, eggs on the rough side, right? Not that bad. But number 4 is not that bad, right? Number 4 is not that bad, but it's on the rough side. Dairy, bread, 1.2. Rice is coming in at a 0.56, right? A 0.56, right? So these are all of the items that your kidneys do not like, right? These items your kidneys have a rough time breaking down, right? Now, on the flip side, you have pasta, right? Your kidneys don't mind if you have some pasta, right? It's only a negative 0.13, but it's still on the right side of things, right? Beans, negative 4, right? So your kidneys do not mind you having beans, right? And fruits and vegetables, your kidneys love you to have fruits and vegetables, right? So take it for what it's worth. A kidney healthy diet is right over here, right? A lot of vegetables. Fruit we got to work through. Fruit, don't go crazy on the fruit because a lot of fruit get too sugary, and then you got the citric acid. Fruit we got to work through. But vegetables, beans, pasta, just say. Just saying, it's crazy. Beef is there with, okay, yeah, I should have put beef up there. But beef is right there with pork. Fish is the worst offender. Okay. Beef is right in here with pork. Red meat. Yeah. The beef is in there with pork.
But how low should I make it? How low do you treat it? All right. So we are going to talk about something that I teach every medical student when they first come into medical school, and I don't teach this, every med student does, something called the Cochrane Library. The Cochrane Library is it is recognized across the globe as the gold standard for taking a bunch of data, putting it together. Independent researchers who are not involved with the study analyze the studies and look at, all right, you got a bunch of people coming up with rules, and you got a bunch of studies looking at different populations, but pretty similar populations. Cut to the chase. What's the rule? What's the best outcome? One of the ways I would teach this to the med students was, all right, when you enter into medical school, there's so much to learn that it's really overwhelming. And you say, well, how do I skip to the end and say, I know y'all have been arguing over whether or not it should be called this or that, or what are the rules, but what's the punchline now? And I would tell the students, if you're arguing with an attending, if you're arguing with somebody who's teaching you, and you present to the argument data from the Cochrane Library, you're going to win. You're going to win. This information comes from the smartest of smartest brainiacs, and they come together without the biases that many studies come to our print job, to the major journals. And as much as we ask the editors of these journals to sort through and look at the outcomes and to recognize bias and to not publish things with overly blatant bias, folks, that ship has long sailed. It's like a study doesn't get published hardly. That's not true, but there's a lot of biases that come into the outcomes of some of these trials.
So we've been saying this forever. We've been saying this forever, right? We've been saying this forever. The journals are good, right? The journals are good. but you still have to understand what you're looking at. You still have to understand what you're looking at. You have to be literate. And that's where, we have to push the information, right? That's where we have to push the information. Okay. All right. So hold on. Let's dig into this.
Gold standard actually uses evidence-based. I don't mean that kind of evidence-based. I mean the real kind of evidence-based medicine where they are looking at, let's go to a different view. They're looking at this question. We have this long history that I just went through of the standard blood pressures that we've used to treat patients since we've been recording, like looking at it again, late.
Hey, listen. You can't think about, right? You can't think about how food impacts the kidney specifically as, food may impact the overall body, or, the standard acid alkaline, or, like it doesn't go, the kidney has a very highly specific job. A highly specific job. So people who have sensitive kidneys, or maybe at stage 1 or stage 2 of kidney failure, they need to take as much pressure off the kidneys as possible, right? And a lot of times pasta is just, if you think about it, like if you just took some pasta and put it in water, right? A lot of times pasta is easier to break down than rice. Yeah. A lot of times pasta is easier to break down than rice, right? And so, it may just be that simple when looking at the difference between rice and pasta. You know what I'm saying? So you don't have to, think that, you're going to the supermarket to buy $3 boxes of pasta. Like this is not, or with all due respect, this is not the Dr. Sabi list. You know what I'm saying? It's Dr. Sabi will send you. I've been on the wild goose chases looking for, certain types of certain types of pasta, and then you find some of these pastas, and then they don't cook the same, and some of them take forever to cook. Some of them cook in literally, 2 minutes. So you done overcooked them and wasted your first few times of trying them out. And it's not that deep. It's just regular, basic pasta, in terms of how easy it is to break down and digest, and on a cooking note, right? On a food prep note, a lot of times when we're eating pasta, our dishes have too much pasta in it, right? A lot of times the dish, it has too much pasta. Like if we're having a meat sauce, right? Whether it's animal meat or vegan or whatever the case may be, but if we're having a meat sauce with our pasta, right? There should be more meat sauce than pasta. If you're having a vegetable sauce with your pasta, it should be more vegetable sauce than pasta, right? So a lot of times there's too much pasta, you know what I'm saying? Because we're eating like it's Thanksgiving every day, right? So, the serving sizes, especially here in the States, I know people are watching from all over the place, but especially here in the States, our serving sizes are crazy. Like before we even get into exact foods, we got to work on serving sizes. Like our serving sizes are nuts. You know what I'm saying? We have King's disease in America. Every time we sit down to a meal, we want to eat like a king or a mobster. Like we have a miniature mobster or a king in the back of our mind. And we just want to have this crazy spread. And if we can't have the spread, like we want to kind of like mimic that as best as we can on a budget. You know what I'm saying? So we'll have a plate of pasta, and it'll be loaded with pasta because usually pasta is the cheapest part of the meal. Or, you know, we'll have our plate of pasta, but then we'll have like 175 slices of bread to go along with our plate of pasta. You know what I'm saying? Like, totally, you know, we our proportion, our portion sizes be crazy all over the place. You know what I'm saying? So woo, let's go with the super chats. You know, I need to get like a, somehow in my mind, when I say super chat, I feel like I need a super cat. Like I need a super cat clip. You know what I'm saying? I need a super cat clip for the super chats. I don't know. That might not make sense to anybody else in the world. But I feel like I need a little super cat. You know what I'm saying? Oh, see, that's what it was. Look at that. Now I thought my intelligence was being rewarded, but really it's because I was speaking favorably of pasta and family. Like, listen, we love pasta. Thank you, Inky, for telling us we can eat unlimited amounts of pasta. I'm not saying you can eat unlimited amounts of pasta. I'm just saying pasta's all right for your kidneys. You know what I'm saying? Your kidneys will appreciate you having, if it's a toss-up, rice night versus pasta night. Now look, hold. Let me say this. You know what? I'm actually glad that you made your super chat, because you actually opened up a more important part of the conversation, right? So it's not necessarily that you sent the cash, even though, I mean, we'll dance for money. No, just kidding. Depending on the day of the month. No, but here's where the numbers come in, right? Because nobody eats, like nobody, unless you working on a serious goal, you know what I'm saying? But nobody just has a plate like this. So the numbers are here, right? And they're in the kitchen chemistry book primarily so that you can look at what you're doing with your plate, right? You can look at what you're doing with your plate, because these numbers works up against each other, right? So now let's say, right, we're looking at vegetables at a minus 9.9, right? Now we're looking at eggs as a positive 4, right? So if I put together some eggs and some vegetables, right, together, and I have me like an omelet, like a vegetable omelet, right? I'm still at, you see what I'm saying? I'm still at a nice favorable spot. My kidneys is still going to appreciate this omelet here, right? My kidneys is not going to mind me having a vegetable omelet. You see what I'm saying? Because of the way the numbers work. So this is how you work the numbers together, right? Or we change this around, right? We change this around, and rice ain't bad. Rice ain't crazy. Rice is a 1.2, right? So we have some vegetables, right? And then we have us some rice, right? We had an 8.7, right? A negative 8.7. So if you have some vegetables and some rice, you still Gucci. Yeah, you still good money. Your kidneys still gonna love you. You know what I'm saying? So it ain't like we not attacking Uncle Ben's. You know what I'm saying? Like Uncle Ben's is still, you know, Uncle Ben's still getting invited to the barbecue. Right? But we just saying you play with the numbers. You know what I'm saying? And then if you want to make it even better for your kidneys, then you go ahead and add you some beans in, right? You add you some beans in, and now you really cooking, right? Because now you at a negative, you know, almost a negative 13, right? Once you add the beans in, right? So it's really about putting your plate together, figuring out what you're doing overall, right? So it's not like, you know what I'm saying? Because we don't really live in, you know what I'm saying? You can't be living in like a, you know, like a super structured, like you living in a cave, like, you know, but you just gotta, you know, flip it and bounce it, put it together. You know what I'm saying? Now, if you add cheese, if you was to add you some cheese to your vegetable egg omelet, then you would have went crazy, right? Because cheese is an 8.5. So once you put the eggs and the vegetables together, you had a 5 point whatever. You add the cheese in, you upsetting the kidneys. You see what I'm saying? So, and if you drink soda with anything, it don't matter what it is. If you drink soda, period, just know soda's a nuclear bomb to your kidneys. So we're not even. Definitely grab that kitchen chemistry book. No. We definitely appreciate the support. And it was a good thought-provoking question, because people will look at the chart and they won't really know how to play with the chart when they start to putting their food together. You know what I'm saying? And, people going to eat their rice. They're going to have their pasta. Some people was going crazy with rice and pasta on the same, same meal. Right? We do that in black households. We might have macaroni and cheese and rice on the same plate. Right? So you just got to know what you're doing. You got to know what you're doing. And if you're going to go dirty, right? If you're going to go dirty, you might want to have half a servings, right? You might want to have half servings. You might just want to have a little mac and cheese just for the taste of it. And then you might want to have 2 servings. You know what I'm saying? You might want to balance that thing off. Right? I'm just saying, play with the numbers. You know what I'm saying? Yeah, play with the numbers.
70s, when we were writing down, here's what we should do. It changed the rules a bunch of times. And when they're using the word standard blood pressure, what they are saying is that, yes, we know some of the trials were getting that blood pressure less than 160 on the top, and some of the trials were getting the blood pressures less than 140. But over that 35-year period, the rules changed. So the guidelines had to shoot for a different number. But somewhere between 140 or 160, they said, okay, we think the blood pressure is controlled when it's at this number. The bottom number was, again, some of the trials were 90s and some of the trials were 100. Over those 30 years, this was considered the standard blood pressure. What this Cochrane Library team, these researchers were looking at.
All right, so let me help, because I see we got people coming into the video and some people leaving out. Okay, so what she's highlighting here is the evolution of how we got to the 120, right? Because 120 was not always the determining factor for high blood pressure. There was maybe the first 100 years of science, 120 was healthy before. If my mother went to the hospital when she was in her 20s or 30s or 40s and she got her blood pressure checked and it said 120, they said, you're healthy. Go on home, do your thing. Have a turkey and cheese, like you're good. You have nothing to worry about at a 125. At a 125 over whatever, you going back to the house, you're good, you're healthy, right? So what Dr. Boz is actually taking us through is how the number changed from basically like a 150, right? Between a 140 and 160, we'll say 150, how that number changed to 120. See, these things are important because these are the things. So again, I know in this world of clickbait, it's hard to get your attention span to focus in. You got to focus, right? But these are the things that allow your doctor to tell you you're going to die. I want you to understand that. These numbers. So you go in there and you check out and whoop, whoop, and they go, oh yeah, well, your blood pressure is through the roof. You got 150, and now you're panicking because you've been told you got a 140 or 150. So now you're panicking, especially as a dark-skinned person, because all your life you've been told high blood pressure is probably going to kill you. You've seen people in your family die from high blood pressure. So now you go to the hospital, they tell you got a 140. You like, oh, your anxiety has kicked in. And guess what? Your anxiety is now creating a self-fulfilling diagnosis. You know what I'm saying? Where because you have so much fear of this thing, and now they done told you got 140, 150, your anxiety is through the roof. Your self-perpetuation of the potential idea is killing you outside of maybe you're overweight, lack of exercise, salt, no salt, caffeine, no caffeine, like none of that. You had a drink, you didn't have a drink, like you had a green juice, a shot of whatever, you know what I'm saying? Like your mind is going to kill you just because you didn't fully watch the Dr. Inky video. You know what I'm saying? Like just because you didn't get that knowledge in, just because you didn't understand that, yeah, 140 is, one today, you know what I'm saying? 140 is high blood pressure, but a couple yesterdays ago, 140 was considered, relatively healthy. You know what I'm saying? Like, so even if, it's dangerous, right? 140, you shouldn't leave. If you're told you got 140, 150, 160, you shouldn't leave the hospital full of anxiety, right? To simplify, so you understand where I'm coming from. You shouldn't leave. Now, you definitely need to leave the hospital with a game plan, right? You need to get your medication, your herbs, your exercise, your new diet, whatever, however you're going to attack it, right? That's your personal decision, however you're going to attack it. But you definitely at 140, 160, at 121, right? At 121, you need to be like, I'm attacking this, you know what I'm saying? But leaving the hospital thinking that, oh my God, auntie, my mom's died from, my pops died from this. Now I got, what I'm saying? Like, oh my, and then you mess around and sleep the wrong way. So now woke up in the morning, your arm is feeling weird because you done, leaned on the wrong position. But in your mind, you got this high, they just told you got high blood pressure. So now I might have a heart, you looking like Sanford and Son. This is the big one. You know what I'm saying? Like, you relax, right? We gotta, so information allows us to really take things in stride. Information allows us to take things in stride and respond appropriately, right? What's the difference? What's the biggest difference between a boxer getting punched in the face, like a professional boxer getting punched in the face, versus like me or you getting punched in the face, right? The biggest difference is the professional boxer is not going to panic. The professional boxer is not going to panic. The professional boxer has practiced, has trained, has learned 100, maybe 1,000 different protocols, right? Different responses to getting punched in the face. So for a professional boxer, him getting punched in the face or her getting punched in the face, Clarissa got a fight coming up. So, her getting punched in the face, give some love to the ladies, you know what I'm saying? Because Clarissa might be, technically the greatest boxer of all time by statistics, you know what I'm saying? But a professional boxer getting punched in the face, they're not going to panic. Now, they have to instantly choose the right response, right? Which is what I'm telling you. Now you get armed with the information. You learn, you build your understanding, you build your database. You learn, okay, this is not a death sentence. I just have to choose the right response, right? So that's why it's important. You know what I'm saying?
That is, well, what happens when we use the new numbers? What happens when we lower the blood pressure down to less than 130 or less than 80? Is it better? It's a great question, and it's not meant for the sissies. If you do not like information and a little bit of science, you're going to like the kind of evidence-based science, you might want to click off. But if you're curious about how these decisions get made and what I think you should be taking home as a take-home message, that's what we're going to cover tonight. All right, so let's get at it. The first thing I want to point out is that, actually, that's not what I want to point out. Sorry, hold on. So this one, I am showing you what the blood pressure. So this is this review that came out in 2022, and it is looking at blood pressure targets for treatment of people with hypertension and cardiovascular disease. All right, I want to skip down and review a couple of things that I do not want people to miss. Number one is it's not an accident that I have a video out there that 1.5 million people have looked at. High blood pressure is the most preventable cause of premature death and morbidity, meaning making your life less lovely. High blood pressure, hypertension, is the leading risk factor for the globally of premature death. That high blood pressure is the most preventable cause of premature death and morbidity, meaning making your life less. Most preventable cause of premature people have looked at. High blood pressure is the most preventable cause of premature death and morbidity, meaning making your life less lovely. High blood pressure, hypertension, is the leading risk factor for the global burden of disease. It is a major risk factor for stroke, heart attack, heart failure, chronic. I'm not arguing that. Nobody's arguing that. What the question we're asking is, how low should we push it? We know that untreated high blood pressure is associated with a rise in blood pressure that gets worse. It accumulates. You know, one of the best teachers of this was my friend Rick Johnson, who wrote the book about uric acid. He's a kidney doctor. He says there's some kind of switch in patients that once the blood pressure has been there for too long, that elevated blood pressure has been there for too long, we can't make it go away. Even with the best of weight loss and ketogenic diets, we can't. Time under the area under the curve matters when it comes to blood pressure. That in the past we have put a lot of weight on age and what that does to the top number versus the bottom number. And you can see that reflected in the guidelines. We know that the standard target declined from this 160 or less to 140 or less. That's why that range of blood of numbers was in that last slide. And the bottom number decreased from 100 milligrams or less to 90 milligrams or less. Millimeters of mercury is what I should be saying. So that part, I don't want anybody writing into my channel saying, Dr. Boz said that I should stop taking my blood pressure medicine because it doesn't matter. That is not what I'm saying. I am saying, how low should we treat it to, and why? So we're going to go down to this. This is the objective that this group of smarty pants at the Cochrane Library says. We want to know if lower blood pressure targets of systolic and diastolic that less than 135, less than 85 are associated with reduction in mortality or morbidity as compared to the standards, which was this 140 to 160 over 90 to 100. Again, that's a range because of the years of the changing rules. And the treatment of people with high blood pressure and a history of cardiovascular disease, stroke. All right. Of course, what's in the back of my mind is how I, to 1.5 million people, used the SPRINT trial to explain that lowering their blood pressure was going to save their life. And the question is, well, was I wrong? And that's what we're covering here. All right, so here we go. I'm not going to tell you how they set up the trial. You can have a link in the show notes. This is public information. You can go read these 75 pages. I'm going to get to the punchline here, which is, first of all, I like to point out that the potential biases. And again, this is fun to see, not fun to see. It's just what should be in every trial, but humans are human, right? They do things that aren't exactly what we wish they would reveal to us. All right. So the biases, there's several places where they said, yeah, these people had biases, these people had biases, but these other ones are what I thought was very interesting. Some of these had a pharmaceutical industry bias. That's the HOT trial and the AASK trial. And then this is a very other curious one where there's early termination, meaning they thought the results were so profound, but they didn't finish the study, and it causes a bias. This is again important because that's the trial that I was quoting you on, right? Okay, so let's go a little bit further, and we're going to look at relative risk, and that's where it leads me to the next slide. I'm going to gracefully change slides. There we go. Oops, not to the Fauci one again. We're going to go to the next one and the next one. All right. A few months ago, I think it was last summer, I used this slide to talk about breast cancer and relative risk. And we said, yes, the people that were in the control, those had 30 cases of breast cancer in the control group. Those were the people who didn't take the estrogen. And there were 38 people who were taking hormones and they got breast cancer. Both groups got breast cancer, but boy, there were more breast cancers in the HRT, in the women who were taking that estrogen. And it was a big scare, and they stopped the trial, and they said, yes, it's a 26% increase in risk. You've got to stop taking the breast cancer, and you got to stop taking the estrogen because of breast cancer in these women. And they were playing a dirty trick. And this is going to be really important when you look at some of the numbers I'm about to go through.
I have type 2 diabetes, but I manage it well. It's a little...
Oh my goodness. They got Broadway musical diabetes commercials. That's crazy right there. That's crazy right there. Okay, here's another book. Right? Here's another book. You need to add this because now, I didn't mention this book earlier only because it's not specifically focused in on high blood pressure, right? But it is specifically focused in on heart disease, right? And we talk a great deal about cholesterol, and we have a good, we have a really good, build dialogue and conversation backed by science on emotions, psychology, and how the brain, specifically the amygdala, affects the heart as a trigger, right? So why that's important is because high blood pressure, right? High blood pressure combined with maybe cholesterol or maybe, glycation, I have type 2 diabetes and whatever, homeboy songs, but high levels of blood sugar, high levels of triglycerides, all of these things can set the stage, right, for a heart attack to take you at any moment. And there are some very important things in the kitchen chemistry book and in this book that can really get you going in the right direction. You know what I'm saying? Especially just, understanding how to change up the diet. Just something as small as maybe, adding in a bag of Brazil nuts. You know what I'm saying? Just maybe something as small as adding in a bag of Brazil nuts, right? To get the cholesterol down, right? Or, speeding up the turnover of cholesterol. not ignoring, for instance, the vast majority of men, right? The vast majority of men are now, instead of, for instance, taking erectile dysfunction, right, as a sign that you need to work on some different things. You have some issues going on, right? They just taking pills, or now they got chews and gummies and all kinds of other things. And this entire industry of sex pills is taking people away from the focus that they need to have on the dysfunction, right? Those things are band-aids that's covering up dysfunction, right? Band-aid. So a lot of times, like, I think it's Viagra. It's either Viagra or Cialis. It might be Cialis. It might be Cialis. But these companies, a lot of times they're making these drugs for heart disease, right? They're making these drugs for blood pressure. They're making these drugs for dementia, and they're failing, right? They're failing, but they have a marketable side effect, right? So say the marketable side effect is it temporarily, opens up blood flow into your privates. So now a woman can have, like, and they're finding this out as they go, right? Because at first they didn't have women's sex pills, but now they realize, women have, women benefit from the sex pills as also because they also have the same issues. Women have erectile dysfunction. That's why they have orgasm problems. Where before orgasm problem just led to relationship problem. Now we learning that the orgasm problem has nothing to do with your relationship. It has everything to do with your exercise, your diet, the quality of your blood, how well your blood is circulating. So you mad with your boyfriend or you mad with your husband, it might be you. You know what I'm saying? Or maybe you using too many machines. Hey. I'm just saying, we want to keep folks together. People breaking up, getting divorced too much. We want folks to stay in love, right? And we want folks to be healthy. And the entire industry of sex pills covers up a basic warning sign that you have a problem, right? So anytime, you don't wake up and you have the sensitivity, or you don't wake up and you have a salute, fellas, that's an early warning sign. Not that you need to re-up on your Blue Chew subscription, but you need to figure out, why your nitric oxide levels are low, right? Or, is your A1C number creeping up on you? Or do you have this silent, symptomless killer, right? Silent, symptomless killer. Sometimes erectile dysfunction is a symptom, right? Sometimes erectile lets you know you got blood pressure issues, right? We just don't link these things the way they should be. But as a naturopath, right? That's how we're trained, right? As a naturopath, we're trained, hey, everything in the body has a function. If something doesn't do the function it's supposed to do, that's not only a problem there, but that's a sign that there's a system-wide issue. So we need to probe, pause, but we just need to look around and see. We need to look around and see what other issues could possibly, what other issues could possibly be there. You know what I'm saying? Yeah. We need to see what other issues could possibly be there.
If your doctor says, if you If your doctor says to lower your salt intake to treat blood pressure, I disagree. There is a better way to treat blood pressure, and you must treat it. Blood pressure is the most vital metric that you control to be healthy. This should be a public service announcement for everyone. Even if you don't have high blood pressure, I'm going to give you the tools to prevent blood pressure from being a problem. Let's start with salt. Manipulating your salt is the short game. The long game, the way to mastermind and win, is to control your hormones. So why do I want you to have lower blood pressure, even if salt isn't the answer? Well, it's because of what happened in 2015, the SPRINT trial. This has changed the way I treat blood pressure within my career. Before this trial, I told patients to keep their blood pressure in the 120s, over 80s. That's the top number being 120 milligrams of mercury to pump the blood forward. And when the heart is filling, the relaxed phase of blood pressure, we wanted that pressure to be 80 milligrams of mercury or less. Prior to this trial, there was an argument that we were being too aggressive about treating blood pressure. So they divided patients into two groups. One who let their blood pressure drift a little higher, like in the 130s, and others who kept their blood pressure below 120 and below 80. And the trial was stopped early because it was deadly to keep that blood pressure in the 130s over 90s. In other words, you lived longer and protected your kidneys, eyes, and end organs when the top number was in the 110s and the bottom number was in the 70s. Let's take a step backwards. This process that we are trying to manipulate is a closed loop fluid system, a hydrostatic system. There is no pool of fluid, a reservoir somewhere where you can manipulate the pressure inside those hoses of your body, the arteries and veins. Within this system, we care a lot about how much fluid are you pumping around, how fast you're pumping around, and this results in a pressure. So that pressure causes the damage. When the pressure was higher, the endothelial lining, or that skin layer inside your arteries, would become hardened. It would change things like the glycocalyx and increase the hardening of your arteries by changing what those cells look like and changing what the muscle was doing in all of your arteries. When patients present and have what the by changing what those cells look like and changing what the muscle was doing in all of your arteries, and changing what the muscle was doing in all of your arteries. And changing what the muscle was doing in all of your arteries. When patients present and have high blood pressure, the first line of treatment is to use medications that slow down their heart rate and relax their blood vessels, because lowering the blood pressure is most important. When it comes to my own health, I want to outsmart the hormone to prevent this problem from ever being part of my medical history. So how do I outsmart aldosterone, that salt hormone? I use a superior hormone, insulin. Insulin is the biggest predictor for whether or not your aldosterone is on the rise or not. High levels of insulin equate to high levels of aldosterone, which increases your blood pressure. In fact, I could guarantee that not the biggest predictor for whether or not your aldosterone is on the rise or not. High levels of insulin equate to high levels of aldosterone, which increases your blood pressure.
Now, I don't know if y'all remember, because some of y'all just getting hip to Dr. Drenqi as of lately, right? But way before the pandemic even, right? Before even the pandemic happened, we did a 12-hour video. Is it before the pandemic? we've done so many of these marathon videos. I don't even know anymore. But I know Rudy has it on his YouTube page. It's a 12-hour live stream we did. And at the time, people were saying, like, the reviews was all over the place just because we were, it was information people weren't really, accustomed to. But we were talking about the relationship between sugar and salt and, addressing it on the level of sugar and salt. But obviously, sugar comes with its own cascade of biochemistry, and salt comes with its own cascade of biochemistry, right? And so up the chain, right? Like, you in the supermarket or you in the restaurant and you get a problem with the employee and you like, yo, I want to speak to your manager. And then assistant manager pop up and they not telling you what you want to hear. You're like, well, I want to speak to your manager. You know what I'm saying? And, you kind of escalate. You can do that in your body. That's what she's talking about, right? Escalating, right? The thing that I noticed that nobody really discussed was that there's a point where you escalate and you get into a pigment. Like when you get to the managers, like when you get to the director of the biochemistry, right? You're in the pigment space, right? So when you get to the manager, like when you go insulin, then you go glucagon, right? And you go all the way up past like leptin, orexin, and all that, you get to melanin concentrating hormone, right? When you escalate, when you go, like sodium, aldosterone, renin, angiotensin, you wind up in the vitamin D melanin space. So, anyway, just very interesting, right? That being dark skinned gives you this high proclivity to die from, and when you follow the biochemistry, right? Both of them end in the pigment system, or rather, I'd say they begin in the pigment system. So I agree with her philosophy here about, going up the food chain. I just don't agree that she went high enough. Like going aldosterone and insulin is like talking to supervisors. No, you got employees, you got supervisors, assistant manager, director. You know what I'm saying? Then you got like district managers. You know what I'm saying? Like I want to talk to a director. I want to talk to the decision maker, right? And so decision makers regarding your blood pressure primarily are, vitamin D and melanin, like this. Vitamin D and melanin, right? So it's UVA and UVB, literally going back and forth, determining the activity in your renin angiotensin system, which then, instructs the kidney, and then you get the whole, aldosterone and, but anyway, for people unfamiliar in the space, right? Aldosterone and insulin is a great, you start digging in those rabbit holes, you know what I'm saying? A great place to start digging in those rabbit. That's why we have so many. If you're sitting there and to yourself thinking, wait a minute, Inky just went. That's the reason why we've written about the subject so many times, so that we can build, people's understanding up gradually, so people understand, have a better understanding. So anyway, let's go back to hear what she's saying.
In fact, I could guarantee that if you have high insulin, your blood pressure is higher than aldosterone, that salt hormone. I use a superior hormone, insulin. Insulin is the biggest predictor for whether or not your aldosterone is on the rise or not. High levels of insulin equate to high levels of aldosterone, which increases your blood pressure. In fact, I could guarantee that if you have high insulin, your blood pressure is higher than it should be. If you have a history of high blood pressure and you want to add back the salt, the first step is lowering the blood sugar. You must start with blood sugar before you can start adding salt back to your diet. So don't go stopping your blood pressure medicines immediately. If you've had a history of high blood pressure, which means you've had a history of high insulin, you will tend to improve things and then might drift backwards. Keeping your blood pressure controlled is the job between you and your doctor, and I would not take it lightly. It will predict your health. Without manipulating these hormones, it might seem impossible to control your blood pressure without medications. It is possible, but it is a slow and steady process if you've been under the influence of high insulin for years.
So hopefully we're following so far, right? Hopefully we're following. It's starting to sink in and make a little bit of sense. Because I know early on y'all might not have been, and then people tuning in at different spots in the video, like it might not have fully clicked. You know what I'm saying? The way that the history lesson needed to, right? How they went from 140 and 160, right, down to 130, then further on down to 120, right? So yes, on one side, they're generating a lot more money for, stop that. They're generating a lot more money for pharmaceuticals, right? They're generating a lot more money for pharmaceuticals. Yeah, the dog on the door just scratching it, like, what are you doing? Why would they let the dog on my office door just scratching my but the pharmaceutical companies make a lot more money, by being able to prescribe more drugs, right? So if you lower the number, you get more prescriptions, right? So that's where part of the debate came in. Like, are we arbitrarily lowering the number so that we can boost prescriptions and make more money, right? And so the test that she's talking about that they did maybe 8 years ago, 10 years ago, right, tested the theory, right? And obviously more complications, high blood pressure, right? More complications, high blood pressure, right? So like I said, we've been tackling the issue a variety of ways, right? There's the food issue, there's the cholesterol, there's the glycation, there's the diabetes, right? There's the diabetes causing high blood pressure, right? There's the high blood pressure causing diabetes, right? So all of these things have to be addressed, right? We are 2 hours in. Hopefully you learned something, but you can't address high blood pressure without addressing diabetes. It doesn't matter if you get the best herbs on earth, if you get the best medication on earth, right? It doesn't matter, right? You have to treat the whole system, which for me is, and obviously more time, things still have to change and evolve, but that right there is an admission that you have to treat the whole body. Whether you choose to go medicine, whether you choose to go keto, whether you choose to go vegan, whether you choose to get a membership at LA Fitness, regardless to what it is that you choose to do, you have to treat the whole entire body. I specifically like that fact that she highlighted the changes that take place in your vessels to the muscle, right? This is one of the reasons why I have to refer to the martial arts space so often, because only in martial art, that's the only space where, you know, like internal muscle building is even a conversation. You don't hear about that anywhere else. Only martial arts talk about internal muscle building, right? Internal muscle building, but that's specifically talking about smooth muscles, right? Cardiac muscle kind of fits the bill as well, but smooth muscles. When you look at the exercises in the martial arts system, it's really for smooth muscles. It's for smooth muscles, and it's for the connection of the spinal, you know, the periphery, right? The nerves that run from the spine to those muscles, and then also the connection of the brain to the spine, right? The motor neurons, the cerebellum, the brain stem, spine, and then out, right? There's really no conversation surrounding this except for martial arts, right? That's why they have me Dan, Way Dan, right? And so, you know, you got the bodybuilder community, they're using nitric oxide supplements, right? They're using nitric oxide supplements, which gives them a synthetic advantage, right? Gives them a synthetic advantage. But outside of that, you don't really have a protocol for it, because the holistic community is inundated with, you know, unfortunately, people still following, you know, Dr. Sebi's program. And, you know, that program, you know, is outdated with respect to the OG, right? But something like beets, for instance, beets are like, that is the natural nitric oxide supplement. Beets are the natural nitric oxide supplement, right? Now, you know, behind beets would just be a lot of greens, right? Greens, because greens have nitrites and nitrates, right? Which, I don't know, it's so much, you know, it's a lot of the stuff is complicated. That's why you got to kind of have a good compass to navigate your way through, right? Because when you hear about nitrites and nitrates, a lot of times you hear about them being cancer-causing agents, right? But those are usually synthetic nitrates and nitrites that are added to like deli meat, you know, or franks, or, you know, like processed meats, right? That is not the intrinsic nitrates and nitrites that are found in necessarily greens. And then the other thing is nature, right? The natures, right? They have put a switch. There's a switch that's associated with nitrites and nitrates, right? So you can flip the switch and they can be cancerous, or you could flip the switch and they could boost your body's nitric oxide, right? And that switch is vitamin C, right? So you have to have, you know, you have to consume vitamin C whenever you have nitrates and nitrites, right? So the beauty about, you know, most natural, you know, vegetables, things like that, is they have vitamin C already. It's already preloaded. It's already preloaded, right? So if you're getting a good amount of greens in every day, which people don't know what a good amount of greens is. A good amount of greens is at least like a half a pound or more of greens, right? Raw, right? If you're cooking it down, then it's going to be at least like 2 pounds, right? Because 2 pounds of greens, once you cook it down, it look like, you know, like a hand, like it's not, because it shrinks, right? It shrinks down, right? So if you're eating it raw and fluffy, right? A half a pound or a pound of greens is huge, but if you're going to cook it and shrink it down, you know, it's not the same, right? Because it's losing water, it's losing fiber, right? So these are the things that, you know, and, you know, a lot of times in the vegan space, you know, Beyond Burger, Beyond Burger with potatoes, fake mac and cheese. Like, you didn't have no plants. You didn't have no beets. You didn't have no greens. You didn't have anything that's going to stimulate that nitric oxide, right? You don't breathe through your nose. Most of your breath, most of your oxygen you take by mouth, right? So breathing through your nose increases your nitric oxide by itself, right? Just small little cheat codes, like before we even, continue to dig in any deeper, small little cheat codes that can set you straight, put you in the right direction, right? Adding a few Brazil nuts in, right? 10 Brazil nuts a month. Listen to what I'm saying. Not 10 packs, 10 Brazil nuts in a month can lower your cholesterol over time, right? 10 Brazil nuts, just 10, right? Raw Brazil nuts, not roasted, not cooked, raw Brazil nuts, right? Stop buying roasted nuts and seeds. That is a trick. You're getting scammed out of the nutrition, right? Because we talked about pumpkin seeds, and then folks is going to buy a whole bunch of roasted pumpkin seeds. That's not the same. That's not the same. You're getting scammed, right? You're getting roasted almonds. That's not the same. Unless you're putting them on your cereal for taste, that's not. Right? Don't get roasted Brazil nuts. Like, don't get roasted nuts. Right? Get the nuts raw. Right? So
estrogen, and it was a big.
all right. Let's see what we got in here. Let's see what we got in here. Now, we do have a new book coming. I don't even want to tell y'all the name of the new book that's coming because it's so crazy. And I've been working on it quietly. Mike, shout out to Mike Carter. Mike been working on it with me. You know what I'm saying? Like, it just, yes. So we have something crazy on the way. We have something really crazy on the way. Okay. Okay. So if you're at home and you're taking notes, right? If you're at home and you're taking notes, right? If you're at home and you're taking notes. High blood pressure, particularly, now women get more varicose veins, men kind of get more hypertension, but everybody can fall victim to hypertension or varicose veins, right? You go arteries, right? Then you go arterioles, then you go capillaries, and then capillaries get smaller and smaller and smaller into infinity. Right? Capillaries get small. You have capillaries. This is important. You have capillaries that are smaller than like the diameter of the blood that has to travel through them. That's how small capillaries are. Right? So a lot of what we need to think of when it comes to protecting our blood and our circulatory system, not just from high blood pressure, comes down to capillaries, right? Comes down to capillaries, right? Capillaries are the small, and when I say small, I mean thin. It's the thinnest part of your circulatory system. I want you to think about what a red blood cell has to do, right? A red blood cell, right? Think about driving, right? A red blood cell is a car, right? Or a boat, right? The red blood cell basically has to get to a specific tissue group, right? And when it gets to wherever it's got to go, it has to slow down. Some places it has to come to almost a complete stop. It has to unload the oxygen, right? And pick up the carbon dioxide, if you will. Like just imagine your mind, right? You got to pull up somewhere, drop off a few bags of groceries, and pick up some garbage bags and load them into the car, right? You got to drop off the groceries and then pick up the garbage bags. Look, that's managed partially, right, by the size of the vessel that the blood is traveling in, right? So you have almost to how our highways are designed, right? The highways, it's just going. That's it. That's artery, right? That's an artery. It's just going, right? The blood doesn't do anything but travel through arteries. That's it, right? It doesn't have to pick up or drop off anything. It's just traveling, right? It's not until you get to the capillaries, right, where things get sticky, pun intended, right? So this is why you see Deion Sanders and, LeVar Ball, this is why you see the impact of poor circulation in your genitals area or in your feet or your toes or your hands even, or your brain function, right? This is where dementia comes in, right? Vascular dementia is the most prevalent cause of dementia, right? Vascular dementia. It's when the capillaries in your brain aren't getting, they're running into the same issues as, like we think of diabetes, people losing a foot, right? People lose a feet. We diabetes, amputation, they amputate your feet, right? But it's because the capillaries get clogged. Capillary gets clogged, you lose the activity in the foot, oxygen's not able to get through, infection, right? Your brain is no different. Blood's not able to get through. If you don't have like a pronounced situation, a brain bleed or, like a stroke or aneurysm or something crazy, you'll just have loss of function. you have loss of function. You know what I'm saying? And depending on the area in the brain, you know, that you lose functionality and the symptoms will, you know, so, but this is an extremity, right? Anything removed from this part of the body is an extremity. Yeah. You know, like arm, leg, arm, head, right? Those are all extremities. Arm, leg, arm, head. Those are your 5 extremities, right? And then you can throw in your genitals, right? You can throw in your genitals because those are loaded with capillaries as well, right? So you have to take care of the capillaries. How do you take care of the capillaries? Nitric oxide and exercise, right? Nitric oxide and exercise, right? So this is where we go back to Kemet, or we go back to Asia, right? This is where you can prop up the health of the entire body, all of the systems on breathing, right? On breathing, right? But it's just not a matter of breathing, it's stressed breathing, right? It's forced breathing, right? We talked about how many oxygen atoms, how many oxygen molecules it takes to break down fat, right? Well, oxygen serves as a trigger for a lot of different things. So when you exercise, right, the combination of lactic acid, glycogen depletion, lactic acid and glycogen depletion sends the message to your brain that you need to build more capillaries. So capillaries are not something that we have to have this whole conversation on capillaries. Just in case you're wondering if this is necessary, this is absolutely necessary. Capillaries are like fingerprints, right? Capillaries are like fingerprints, right? No 2 people have the same amount or types of capillaries. It doesn't go like that, right? People are building capillaries and losing capillaries every day. In the process of this video, you've been either slowly but surely building new capillaries or slowly but surely losing capillaries, right? That's how that goes, right? And once upon a time, it was thought that losing capillaries was just a part of aging, right? Now we know differently, right? Building new capillaries or losing capillaries is simply just a matter of your body's dynamic efficiency. Your body's dynamic efficiency, period. If we're not using this, we might as well break this down so we don't have to put any energy into that, right? It's like budgeting money in your household, right? If we're not using that, we need to cut that bill off. That's just an excess bill we're paying. Doesn't make any sense. Your body's the same way. If you're not using these things, we need to break that down and save energy. The problem is you voluntarily get to determine that. It's not a part of your programming. Like you don't get to decide whether you breathe or not. Right? Your body's nervous system is going to take care of that for you. You're just going to breathe, right? But you do get to decide whether you're going to exercise or not, right? And so you do get to decide, whether you're going to get that salad or that pasta. Now, if we want to go deep down the rabbit hole and start asking questions like, why is salad loaded with cheese? Right? Let's look at these numbers again. Why is salad loaded with cheese? So Hey, we could go through the conspiracy and say maybe to keep you spinning. They spinning you. They spun you. You thought you had some salads and you thought you did something for the day, but you didn't, because you loaded up your salad with dressing, right? You loaded your salad up with French dressing or ranch, right? Which is nothing but sugar or cheese, right? And then you put actual cheese crumbles in the salad with bread. You didn't added bread, cheese, and sugar to the salad. So basically, you might have just did better with the mac and cheese. Respectfully, you might as well just had the rice and the fries and the ketchup. Like you perverted the salad, so your salads are neutralized, right? Once you take the vegetables and then you add cheese and bread, right? You add cheese and bread, and then you add like a French dressing, which is nothing but sugar. It's probably got fructose, like, because the cheese and the bread alone bring you to a 9.7. So once you add the cheese and the bread to the vegetables, it almost just totally cancel out. So you didn't do nothing, right? Just think about it that way. You didn't do nothing, right? So you see where I'm going with that? Hopefully, because I want you to be able to grab some parts of this conversation and not just add to your database, but I want you to have some functional parts, right? Stuff that you're going to listen to tonight and go, okay, I get it. I'm on this in the morning, right? I'm on this in the morning, right? We're going to start adding a little bit of onion. Yeah, we're going to start adding a little bit of red onion and some greens to the smoothie in the morning, right? Because 99% of the people watching this video are probably having protein shakes. I ain't even gonna mess with your protein shake. I'm gonna just say, just add you a little bit of onion, like a little bit of red onion. Drop that in the protein shake, and get you some greens in there. Yeah, get you some greens in there. Don't juice the greens. Put the greens in the smoothie, right? Don't juice greens. I know a lot of y'all like, oh yeah, I be drinking the green juices. Stop juicing your greens. Like, hold up, doc. Now wait a minute. Stop juicing your greens. Don't put kale, mustard greens, and don't put your greens in the juicer. Now, if you want to juice your whatever, your apples and your whatever, don't juice your leafy green vegetables, right? If you want to really get busy in the kitchen with your green juices, juice you a few pieces and then take that juice and throw that juice in the blender. And then add the rest of your ingredients to the blender, right? But the main difference between the juicer and the blender is that the blender is going to give you much more complete nutrition. The juicer is going to rob you of fiber and pigment, and any nutrients that's locked up in the fiber and the pigment, you might lose in the juicer. That's why I tell people, don't throw that stuff away. You might want to eat that stuff. You know what I'm saying? But everybody ain't there yet. You know what I'm saying? So I'm just saying, leafy green vegetables. Stop juicing your leafy green vegetables, right? You're losing pigment. You're losing fiber. You need those things, right? You need to get that whole green. So, if you're going to get you some beets, go organic. You know what I'm saying? Beets are cheap. You can get you a nice little bundle of beets. It'd be like 3 or 4 beets on a bundle. Anywhere from $2 to $4 in the supermarket, organic. And it'll have the stalk of the beets attached. Drop that whole, don't drop it in the blender, but chop that bad boy up and put the whole thing in there. Blend that whole thing up. Blend that whole thing up. You know what I'm saying? Now, just eating these things does not give you the nitric oxide, right? Because beets don't necessarily have nitric oxide in them, just like the nitrates and the nitrites from the greens are not nitric oxide, right? Your body has to perform the biochemistry to convert those things, those precursors, into nitric oxide. So in the beets, you're going to have arginine and citrulline, right? Inside the greens, you're going to have the nitrates and the nitrites, right? Now you have the vitamin C, and then you need exercise. Exercise is going to be the conversion factor, right? When you put that exercise in and you start stressing the system, when you get that exercise in and you start stressing the system, yeah, and beef will be over here. Beef is under pork, but the thing with beef is, right, because beef come in somewhere around like a 7, you know what I'm saying? But the thing with beef is what part of the cow, like it get a little crazy, right? So just know red meat specifically is anywhere from like a 6 to like a 10, you know what I'm saying? So it's over here, right? And then it gets even crazier because the stuff that we getting from the supermarket calling it beef, that ain't even like fresh beef, right? That ain't even fresh beef. So it gets even crazier. The conversation gets even crazier, right? But here's that math, right? We're going Neferland, right? Jet Propulsion Lab, right? We're going to the Neferland Jet Propulsion Lab, right? And your muscles normally have 4 milliliters of blood. Every 60 seconds, right? Your biochemistry is based on the number 60, right? So this is why our program is based on 60 and 60, right? Because we want to change what goes on in your body every 60 seconds, right? So now at rest, for most of us, I got to stress this, for most people on average, right? This is an average, right? The more triglycerides you have, the more overweight you are, the more higher your A1C is, the higher your cholesterol, you know, all slows this down, right? Slows this number down. So you might be getting 2 milliliters of blood circulating through your muscles every minute, right? You might be getting 1. You might be in super trouble, right? So when you exercise, you change this number, you can change this number up to even higher than this. But this is on average, right? This is on average. Why am I putting that there? Not to tell you that exercise is like a cure, but exercise is a trigger because your body has to change its biochemistry in order to facilitate the excess blood demand of all of the muscles that you're working, right? So you need more oxygen, right? You need more oxygen, but you need more nitric oxide. Like I want to stress this nitric oxide thing. If we walk away with just a couple of jewels, like Nas, I put some jewels in his coat that he could sell if he chose. If we walk away from this video thinking nitric oxide, we winning. Because nitric oxide benefits every single aspect of our health. And we don't need to order it in a powder because that's not the same. Right? Even though the people ordering powders of, pre-workout, which is nitric oxide combined with caffeine and sugar, you know what I'm saying? Some mixture of that, right? It's pre-workout. So literally the category of product it is has already like predisposed the person to use that, to take that right before they start exercising, right? Because exercise creates this demand. Exercise ramps up your nitric oxide synthases, like all of the enzymes that. Now, you can increase the enzyme activity even more by being outdoors. So there's a big difference in nitric oxide production from working out indoors, like in a gym, versus working out outdoors. Doesn't need to be in a specific place, just in the sunlight, right? The sunlight is going to increase the nitric oxide production, right? But 50 times the amount of blood, 50 times, we're talking about now 200. 200 milliliters per minute every 60 seconds, right? This is a part of what we call getting a pump, right? This is a part of what we call getting a pump, but it's more important. Getting a pump is like a real vain, like that's vanity, you know what I'm saying? Trying to work out to get a pump. There's a lot of medicinal benefits associated with a pump, with increased blood flow, especially over time, right? Because in order to get the blood flow, it's not just nitric oxide, right? It's not just nitric oxide. It's not just nitric oxide, it is those muscles. Right? The smooth muscles that line the vessels, right? So you're actually pumping these muscles. And actually, that's where a large majority of the nitric oxide is going. Nitric oxide is not only going to help the muscles contract and relax, but it's also going to help dilate the vessels overall, right? So it's going to help to push more blood forward, but it's also going to help to open the vessels. Opening the vessels and keeping them dilated, right? Keeping them relaxed and dilated is a large part to the long-term solution, right? The long-term solution to your blood pressure, right? Which is what we want to ultimately achieve. Right? Ultimately, we want to get a long-term solution, right? There's no health, there's no healing without exercise. That is a fact. There are scams, though. You can definitely be scammed into believing that you're going to just take this herb or this sea moss or this medication. You know, we're going to give you this pill You know, but on the flip side, here's the thing. On the flip side, you know, there's people that are, you know, that'll tell you all you need to do is eat less and work out more. And that's just as incorrect, right? That's just as incorrect, right? It's a combination of things, and you need to know how to put them together. It's doing the right type of exercise, right? It's doing the right type of exercise, because once you have high blood pressure, you can't just do any type of exercise. You know what I'm saying? Like, somebody hit me up and was like, man, I tried to do these burpees and I said, whoa. Who told you to do burpees? Like, what? Who told you to do burpees? When I seen this guy on the YouTube and he was doing, I said, oh my God. If y'all don't stop following these steroid popular, like, if you don't stop, you know what I'm saying? Like, so anyway, right? Let's go to, for the people that have their books already, right? I want y'all to go to, I want y'all to open up the book and start getting busy. Getting busy with it. Getting busy. All right. I guess we can go to page 14 and try to get through some of this book. We'll read through some of this book. Right, let's go to page 4. Matter of fact, let me see if I can pull it up on the screen so that the folks that don't have books, they get a little sample. They get a little sample. Folks that ain't got books, we give them a little sample. You know what I'm saying? Let's work with the folks. They may not have their books. Let me see where I'm trying to take y'all to. Because the fact that this is a Ebers Papers book, you know, it's a bunch of stuff in this book. Okay, here we go. This is what page 14. And then the pages in my computer is not the same as the pages in the book, so I gotta find stuff the hard way. All right, so let's walk through some of this, right? We know that strength is the number one factor in reduction of all-cause mortality, followed by muscle tissue. We know about the 5 forces acting through the flesh: spin, gravity, particularly a big player in the circulatory system. The muscles are electric, the skin is electric, the nerves are electric. What we want to propose that strength is a unification of electric force from the muscles, nerves, and the skin, as well as the translation and articulation of the bones. Repetition creates unification, the hand-eye coordination, mechanotransduction, etc. The heart, spine, and brain are at the center of this force unification. The act of exercise allows you to unify electrical activity throughout the body, as well as create a rhythm with your breath. You have to remember the physical is what's within your grasp to see, hear, feel, and touch. The spiritual is operating in, through, and around the physical. Take nitric oxide, for example. Nitric oxide optimizes blood flow. What does that mean? It increases the spin of each red blood cell and the vortexing of the cells while traveling through the vessels. It means faster feeding and cleaning of the body's cells. This means everything carried by the blood, platelets, immune cells, the whole gambit. With increased blood flow and oxygen, you have better nerve function, faster nerve repair, and stronger nerve blood vessel interaction. All right. So, quick point. Your nerves and your blood vessels work together. They are in a they're in a loop, right? So the nerves are attached to and instruct your vessels. Your vessels have to feed the nerves. Nerves have to have a blood supply. So there's no one without the other, right? There's no one without the other because blood supply is going to nerves, but nerves are going to tissues, muscles, organs, glands, etc. Right? So you have to have both, right? You have to have both. But the key is growth of and feeding of the nerves, because your nerves grow, right? It's not like you get a set amount when you're a baby and you're born and then that's it forever. No, your nerves continue to grow, just like your circulatory system continues to grow, right? Unless it's atrophying, unless it is breaking down, right? Degenerating. That's a problem. That's what we're discussing, how to stop the degeneration and get back into the building, the adding on, the growing, the anabolic phase, right? The healing, right? Okay. With increased blood flow and oxygen, you have better nerve function, faster nerve repair, and stronger nerve blood vessel interaction. This translates to a stronger mind. The neuron and immune cell signaling for cross communication increases as gap junction activity amongst like cells improves. Okay. Gap junctions are the things that connect your cells and make them into tissues, right? Just to simplify it and make it make sense, right? So that's what a tissue is, right? A tissue is a bunch of cells clumped together to do a specific thing, right? So you got a whole bunch of cells together that make up your, liver, spleen, kidney, whatever, right? They're connected by gap junctions. And the gap junction is basically like a phone line, you know what I'm saying? So they could kind of like hit each other on the cell, you know what I'm saying? Or like a delivery system where they can share molecules. But just for simplification, it's a communication system that exists between like cells that doesn't exist throughout the whole body, right? So throughout the whole body, cells communicate largely through the nervous system, but that's typically between you, like your mind, your conscious mind, your subconscious mind, and the cells. Cells communicate amongst each other, right? So all of your cells, for instance, like all of the cells in your spleen have to talk. All of the cells in your kidneys, they got to talk. All of the cells in your pancreas, they have to talk to one another, right? And so gap junctions are those things that keep them in communication. And when they stop communicating with one another, that's an early warning sign that somebody's getting ready to become a cancer cell, right? Because cancer cells pop out of the group. Cancer cells pop out of the group. They stop communicating with the rest of the family and start doing their own thing, right? So, that's the forwards and backwards, While you as a whole get stronger and smarter, so are your cells. The fact is your improvements as the whole are secondary. Your cells get stronger and smarter first. Once the parts of the machine run more efficient, the overall machine runs more efficient. These are physical aspects. This is because the electricity and magnetism is raging. Increased blood volume, flow, and strength means increased magnetism. Increased heart strength means increased magnetism. Increased nerve and neuron function means increased electricity. The combination of the two means the soul and the spirit are strengthened, right? Increased ion and cell membrane activity speeds the electrical potentials generated by your cells. All right, just in case you don't know what we're talking about, this is what we're talking about. Well, I erased the top part, but remember, going from 4 milliliters per minute of blood flow to going to over 200 milliliters per minute of blood flow through your muscles. That's what we're talking about. All of the changes that happens, right? And as these changes are happening, the biochemistry changes. New chemicals are created, right? Your body runs out of resources, so you have to have more nutrition, right? Things like water-soluble vitamins runs out. Right? You have to replace those B vitamins and C vitamins. The more you exercise, the more you need vitamin C, and the more you need the whole B family, just the whole B family. You need them more often, right? So the standard daily amount of B vitamins and vitamin C, I ain't gonna say you should throw that out, but it's already been thrown out. Let's just say that, right? When you go to the store, right? When you go to anywhere, Amazon, Vitamin Shop, GNC, even if you go to the corner store or the convenient or whatever however your city works, the gas stations, the corner, whatever you call it, the 7-Eleven, right? And you get an energy drink. When you turn that energy drink around and you read the ingredients, it says like, matter of fact, let's see if we can pull up one. Let's see if we could pull up one real quick. One time for the one time. Like, let's just pull up one. We should be able to pull up. Like, let's look at an energy drink. Let's look at Monster. I guess Monster is probably popular. Monster. Yeah, let's look at Monster ingredients. Ooh. Let's look at these ingredients. Can we see some ingredients? Okay, perfect. Here go one right here. Here go one right here. Let's look at this one real quick. Boop. All right, you can see that. Let me see if I can make that bigger. Oh no, that's the biggest I can make it. Oh wait, let's see if I go to the site. Oh, okay, I can't go to the site. All right, well, that should be good enough. But what I'm trying to highlight is this, right? It says vitamin B2, right? 250%. Vitamin B3, 250%. Vitamin B6, 240%. Vitamin B12, 490%, right? So it's well known that you need more than 100%, like, which is what the daily recommended doses are, right? It just, your body requires it, right? Anytime you experience stress, like you argue with your girlfriend or your boyfriend or your husband, your wife, or something tragic, crazy happens throughout the day, you're going to lose your B vitamins. They're going to come right out. You're gonna run through them instantly, and that's they gone, right? So any sort of stress, you need more B vitamins. The whole program, B and C, all your water soluble vitamins. Just think about it that way. Any exercise you're doing, you need the whole program again. Vitamin C with all the B vitamins. You need that whole family of water-soluble vitamins all throughout the day, at least 3, 4, 5 times throughout the day, right? Depending on what your day looks like. Now, fat-soluble vitamins, Your body stores those, right? That's A, E, K, D. Like your body stores those. But water-soluble vitamins, forget about it. Especially if you're drinking a lot of water. Even just drinking a lot of water, you're gonna need, because you're gonna keep changing the water in your body, and then you're going to the bathroom to pee all day. You got to get more vitamins in. You know, people worry more about electrolytes, but you really need to get that vitamin C and those B vitamins in. Right. So, you know, just you know, trying to bring that home. You know what I'm saying? Like you have to increase the level of nutrition to match your activity and what you're trying to do. Right. All right. Each time, blah, 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 blah. Okay. We can skip some of this. All right. So this is self-generated medicine. The body's healing mechanisms and regenerating mechanisms go into full throttle. It's basically flipping the anabolic switch on without the mTOR growth factor. Knee Dan versus weight Dan. You can build outwards or you can build inwards. This is what the 4 milliliters per minute to 200 milliliters per minute means. This is in John Q. Public. An athlete can have up to 400 milliliters per minute of blood flow throughout their muscle tissue. Right? So this means that as you continue to exercise, right, what's happening is not only are you increasing the amount of, you know, all of the different biochemicals and all of those things, but you're building the internal muscles. The stronger your internal muscles get, right, the stronger the impact they have every time you're like your regular muscles, right? When you first start doing push-ups, right? When you're doing a push-up, just think about what the nature of a muscle relaxing and contracting is. A muscle relaxing and contracting is generating a specific amount of force, right? Force translates at being able to move an object, right? So when you have weak, smooth muscles, right? Even if you exercising, it's barely going to be able to move the blood. Now, mind you, the worse conditioning you're in, right? That means you got more sludge inside the circulatory system, right? So you got glycation, which is sugar attached to the blood. You got triglycerides, which is fat in the blood, making the blood like thick and slow. You got cholesterol and, you know, pockets of fat, you know what I'm saying? Like you got all kind of stuff in there slowing down the blood flow, right? And that's accompanied by weak muscles, right? So you actually need stronger muscles. Like it's like trying to drink a thick milkshake, but in reverse, right? The thicker the milkshake, the harder you gotta, you know what I'm saying? I don't know, maybe with the Diddy trial, this is a bad analogy, but you get where I'm going with that. I'm just going back to the information now. All right. So you can build those internal muscles. Now, that's why we have to understand, you know, some of this terminology, right? Cardiac output, right? Heart rate and stroke volume. Cardiac output is the total blood circulated every 60 seconds, right? The total blood circulated through your whole body every 60 seconds, right? That changes, right? Your cardiac output changes as you exercise, as you build up endurance, as your muscle efficiency increases, right? As your, VO2 max, right? VO2 max is a measure of how well your body utilizes, you know, oxygen. And so that's basically inhaling oxygen, then oxygen going from the lungs to the blood, right? And then going from the blood, like there's the series of handoffs, right? So you filling up your lungs, right? So that's the thing. How well do you fill up your lungs? Like we could stop right there for a second, right? How well do you fill up your lungs, right? So you're like, wait, what does that have to do with anything? Well, you smoke Black and Miles, you smoke blunts, you smoke cigarettes, or you smoke all three, right? Or you don't smoke right now, because folks quick to tell me they don't smoke. No, I don't smoke. When you stop smoking, right? Oh, well, I stopped smoking like last month. Okay, well, technically then you still smoke. Yeah, if you just stop smoking, you still smoking. Let me just let you know that. Your lungs have not changed condition from, it takes 5 to 10 years for your lungs to go back to normal from the time you stop smoking. And that's an average based on how bad you did your lungs, right? Because smoking is smoking, right? People that smoke, because they live in a delusional place, they mind, like it's an insanity. Trust me, I know, because I've been there, right? You compete over smoking. Yeah, you compete over smoking. Like people that smoke blunts argue against people that smoke cigarettes. Like, nah, the blunts is nowhere near as damaging as those cigarettes. And the people smoking cigarettes, like, is you crazy? One blunt is like 3 cigarettes. And so they go and then you got some people that smoke blunts and smoke cigarettes. And if they don't have a blunt or a cigarette, they grab a Black and Mild, you know what I'm saying? Or they feel like they done got a little more refined in life. So they smoking cigars, they smoking cigars and drinking wine. Like, you're still getting spun. You're still getting tricked out of position. Period. Any amount of smoking, any amount of alcohol is hurting you. Period. Just know that. There's no amount of healthy alcohol drinking. I don't care if it's red wine, white wine, Tito's. There's no amount of healthy drinking, right? Not a shot, not a cup, not a glass, none of that. Yeah, you can get you some resveratrol somewhere else. You like none of that. But so how well does your lungs fill up with oxygen? And then how well does the pulmonary membrane allow that oxygen to dissolve into your blood, right? So that's one thing, right? Then once the oxygen is in the blood, right? What are your iron levels like, right? Inside the muscle tissue versus inside the blood, so you could get that other handoff, right? So there's one handoff, environment to lungs. Then there's another handoff, lungs to red blood cells, right? Or lungs to hemoglobin. Then there's another handoff, hemoglobin to myoglobin, right? Hemoglobin to myoglobin, right? So that's another handoff, right? So, there's a series of handoffs that has to happen, right? Or whether, you got some dissolving through the interstitial fluid and some other stuff. But so there's a series of handoffs. So typically that whole system is measured with VO2 max, right? Now, there are other systems that just don't have measurements. People haven't invented, they haven't came up with anything, you know what I'm saying? So we're pioneering and coming up with stuff, right? But there needs to be a measure for insulin utilization. There really is no measure for that, right? There's no measure for insulin utilization. They either say you're insulin resistant, you're diabetic, or you have high A1C, right? So that's how they look at it, right? If your muscles are doing well with insulin, then you just not sick. Like, but there's not a number that can quantify your level of efficiency, right? So we need that. We need a Dr. Inky number for insulin, like an insulin efficiency number. But I guess there's so many different things that we should still there should still be an efficiency number, right? How to create that? I don't know how to create that number. That would need maybe a greater mind or a few minds. Yeah, we had to put, you had to put an all-star cast together maybe to figure out how to put that number together. Now we've created our own system, right? We've created our own system, and we talk about that system in the bioelectricity book. So it's not necessarily per se a number, but we'll save that. If you have the bioelectricity book, then you know what we on, but don't tell the people that ain't get the book yet. If you ain't get the book yet, then you need to go get the book, right? But that's a whole nother added on additional piece to the puzzle, right? So as you speed the blood flow, right? Because I want to walk through this in a functional way. I don't want to just bombard you with scientific terms to the point where you're not really understanding what the implications of everything are, like what stuff means, right? So as we speed up blood flow, right? As we go from 4 milliliters, right, to somewhere in between 200 milliliters, right? You're also speeding up the breath, right? And then you're also speeding up how fast your body is metabolizing sugar and metabolizing insulin, right? So it's not just 50 times the blood flow, right? But it's potentially 50 times the amount of insulin being metabolized, right? So understand the connection, right? So understand the connection. And we've already heard from Doc, right? Dr. Boz, right? Dr. Oz, Dr. Boz, right? The easiest way to get the blood pressure down, to get the aldosterone level down, is to get the insulin level down, right? Easy peasy, 1, 2, 3 We're going to get the insulin level down, right? We're going to get the insulin level down, right? That's why we talked about nitric oxide. Nitric oxide is the reason why there's no nitric oxide, the reason why you don't go to the hospital and get nitric oxide, don't confuse this with laughing gas, right? But the reason why there's not nitric oxide per se, like in the hospital, is, and technically in some situations you might get some nitric oxide, but for the most part, it's not known as a pharmaceutical drug because this is self-created medicine. The Netchers have already provided you with medication. Your body produces it on its own. You just need to know how to press the buttons to get your body to produce it and then produce it at higher and higher levels, right? So there's an inverse relationship to nitric oxide and insulin resistance, right? This is one of the reasons why as people get more physically active, they get more insulin sensitive, right? Because you start glycogen depletion, right? The more you're moving, the more you, especially tapping into the fast twitch muscle, you're getting rid of the glycogen. Now your body has to pull in a lot more blood. I mean, a lot more blood, but also a lot more blood sugar coming with the blood, right? And so now your body's on a bike, right? It's metabolizing sugar a lot faster, right? It's metabolizing sugar a lot faster. So with that being said, obviously you're going to be producing a lot more free radicals and toxic metabolites that your body has to get rid of. So that's kind of where herbs and antioxidants and, you know, some of those other things come into play on the back end. You know what I'm saying? But just keeping the main thing, I want you to understand what increased blood flow means in terms of how directly it impacts lowering blood sugar, and then how lowering blood sugar, because you lower the insulin, you lower the aldosterone. You lower the aldosterone, you immediately get the kidneys to go, oosa. The kidneys immediately go, ah. Right? The kidneys, like the kidneys took a nap. Like when the kidneys get crazy, it's like they turn into old folks. You know what I'm saying? Old folks, you need to have a nap time. Okay. And in case you didn't know, you was an old, you know, if you over 40, you need a nap. I'm gonna just let you know. If you are over 40 years old, you need a nap throughout the day. Because what happens is you turn 40 without, like, nobody even warned you. You was 39 and you just became 40. There's not like a welcome package, like you're 40 now. Here's the manual. Here's the new manual of how your body works post 40. Like, you don't get that, right? So I'm just letting you need a nap time. You need a nap time. You need a little, even if it's a 10, 20 minute, you need a nap time post 40. Just letting you know, you need a nap time after 40. Yeah, because you got to let certain things reset. You need some reset action going on. You know what I'm saying? Like, anyway. What? Smoking weed is not good for you. Listen, smoking weed is not good for you. Let me just make sure I say that on the record. Smoking anything is not good for you. There is no amount of smoking that is good for you. There's no amount nor type of smoking that is good for you or healthy. It just does not exist. Okay, there's no such thing as healthy smoking. There's no good smoking. It don't matter if you're smoking, because some people actually smoke herbs. Like, some people call weed herbs. They'd be like, you're smoking herb. But some people smoke actual herbs, right? And they'd be like, nah, this is good for you because I got this in here and that. Like, nah, nope. Now, THC is good for you. You know, your body has a cannabinoid. So it gets confusing, right? Plus, we like to justify our own BS. You know what I'm saying? We like to justify, like, you got to remember this. Addiction is in your brain, right? Just understand this. If you understand this, a lot of other stuff will hit. Addiction is in the brain. Logic is in the brain. Addiction is in the brain. Logic is in the brain. I want you to just put those two together. Addiction and logic both live in your mind. They're in your brain. They're up there. So when you become addicted to something, you start logically convincing yourself why you need to have that right now and how it's not really that problematic and how it fits right into the budget, the schedule. Like, yeah, you start logically. Yeah, no. Trust me. So the worst thing that could have happened was the cannabinoid system research went public. Because once the cannabinoid system research went public, everybody was like, what? I knew smoking weed was good for me. Like, yes, this is exactly what because I was getting ready to start trying to quit, but why would I? Look at this research right here. This is good for glaucoma. You don't even got glaucoma, like. But the cannabinoid system, and yes, weed, you get cannabinoids from cannabis, right? But no, you don't need weed at all to have cannabinoids. Your body produces cannabinoids all by itself. No weed is needed for cannabinoids. You don't need an edible. You don't need to smoke it. You don't need any type of marijuana plant at all in order for your body to get all the cannabinoids that it needs. Your body produces cannabinoids from, so remember earlier I was saying balance, right? Ratios, right? And we were talking about sodium, potassium, omega-3 and omega-6, right? So your body produces cannabinoids from fatty acids, right? Now, the problem is almost everybody in America and Europe is starved of cannabinoids. So our cannabinoid system is like super deficient because our diets are upside down. We're having like we supposed to have 4 times as much omega-3s as omega-6s. But the way our diet is set up, we get like 4 times as much omega-6s as omega-3s. So instead, we activate the prostaglandin system and inflammation, and it just goes the wrong direction. You know what I'm saying? As opposed to having more omega-3s than omega-6s, and then we'll be producing cannabinoids to quiet inflammation. But yeah, no, smoking weed is not good for you. There is no textbook reason why we need to smoke weed. Anything that we can get out of the weed, we can eat it. And that's if it's lawful in your city, town, wherever, you know what I'm saying? But you can eat it. You can do an edible to get something you want to get out of it. But if it's cannabinoids, you don't even need weed at all for that. You know what I'm saying? Like, yeah. So there's never a good reason to smoke anything. Now, is smoking weed very enjoyable? Unfortunately, I'm from the Bronx. So I have smoked way too much weed to disagree. But I will say this from experience. I don't smoke now. But I'll say this from experience. Weed is highly addictive, right? Weed is highly addictive. And not only do you get addicted to the weed, right, which was a part of the reason why they increased the THC in all of the strains out there. So there's no more natural weed floating around, right? All these hybridized, created strains, right, to increase the addiction. But then also, if you smoke blunts, you're addicted to tobacco, just like a person that smokes cigarettes, right? Even though you may not know it, you know what I'm saying? But if you smoke Fanta leaves or you smoke blunts, or even worse, you smoke blunts mixed with Fanta leaf in it or wrapped around it, oh my God. God, I'm gonna say a prayer for you tonight. Because you be doing better with a pack of Newports. Yeah, that Fanta leaf is crazy. Fanta leaf is 100% pure tobacco. But people add Fanta leaf to backwoods, and smoking is the devil's. You need to stop smoking as soon as you can. Everybody, stop smoking as soon as you can. Never smoke again. Don't smoke a cigar. Don't smoke a blunt. Don't smoke a cigarette. Don't smoke a joint. If you want to smoke, hit a bong. You know what I'm saying? Like just weed alone. But I would say don't even do that. You know what I'm saying? Like eat an edible. You know what I'm saying? If you're trying to get the high without eat your edible. You know what I'm saying? But yeah, don't smoke anything. No smoking, anything at all. No alcohol. Anything at all. Just like Elijah Muhammad, we got to, hey, Elijah Muhammad laid the groundwork for that. No smoking, no drinking. Clean it up. You know what I'm saying? Now we just have scientific data to back it up. Like it's messing your lungs up. Right. So anyway. All right. So cardiac output. Listen, let me tell you, I've been there myself. That's how, listen, oh my God. You know what? I must have touched a nerve. But that's a fact. Yo, we got to talk about these things now. Oh my God. Yo, vapes is, God help our people. Seriously. Because every time we just start to figuring it out and get one monkey off our back, it's like they come up with a whole new thing. You know what I'm saying? Like, nah, the vapes is good because stop it. None of the hookahs, vapes, nothing. Don't be tricked out of position. That's the best phrase that you could use, is because we getting tricked out of position left and right. We don't need to smoke nothing. Period. No smoking. Don't even smoke your meats. If you eat meat, like don't smoke nothing. You know what I'm saying? Period. All right, so cardiac output, right? Heart rate. Now, I'm not sure I went into it right here, but I'll mention it here, right? This is one of the reasons why the batana oil we have is so important, right? Because the batana oil we have got the vitamin A and the vitamin E. Now, when we're talking about increasing the blood flow, you got to know you're increasing the heart rate. When you're increasing the heart rate, you're also increasing the aorta activity, right? So you're going to be producing more free radicals. You have to increase the amount of fat soluble, specifically vitamin E and vitamin A for your heart. No way around it. So if you're doing more exercising, but you're still taking the same amount of vitamin E and vitamin A, or you're still eating the same amount of vitamin E and vitamin A, you're hurting yourself. This is why you have those studies floating around where they're like, oh, well, more exercise is dangerous. And then you got people looking at them crazy, like, what do you mean by more exercise is dangerous? Because people are doing more exercise, but they're not increasing their nutrition to match the exercise level. They just hopping up. They go, oh, exercise is healthy. Inky said exercise, or whoever. Chris Bum said, you know, whoever they watching, right? They watching the pull-up guys. You know, I just saw Akeem Supreme. He did 1,000 pull-ups, and, you know, yeah, so I'm getting ready to start this pull-up program. I'm trying to lose some weight. And so a lot of people make this mistake, and exercise actually hurts them just over time. They don't realize it though, because people trying to lose weight, they don't increase their nutrition. They are decreasing their nutrition because they're dieting down, right? So they're taking in less antioxidants, less vitamins, less minerals, less pigments, less fiber, and they're doing more exercise. That's just putting more stress on your body. And over time, they realize they're not really getting the full results because their cortisol level shoots up through the roof higher and faster than the testosterone does, right? So, you know, yeah, you can't just, you have to match. The nutrition has to go up. That's why in order to do it right, you know, losing weight, even not even just focusing, because losing fat is harder than losing weight. Losing weight is easier because you're just trying to come down, right? But even losing weight, to do it right, you gotta have like you're gonna go like this on the scale, right? You say you 200 pounds. If you're doing it right, when you start your program, you might drop to 190, right? But then you're gonna go on the scale one day and you're gonna see you 196, and you're gonna go, what did I do wrong? You might just get discouraged and go eat like a half a cake or half a bag of cookies. Like, this ain't working anyway. I might as well just have this whole small Domino's, like Little Caesars, then came out with the cheese inside the crust. You're like, yo, I might as well have this whole little, you know what I'm saying? I would have gained it. But that's not how it goes, right? Because what happens is when you start exercising, you know, immediately some stuff starts moving around. You start peeing more, you start pooping more. And so a lot of weight you losing comes from peeing and pooping, right? So you coming down, and then, you know, you exercising, so you cleaning some stuff and you drop. Well, after maybe a week or two, when your body starts healing back, right? Muscle is kind of heavy. So you'll put on some weight. Even if you haven't gained a pound of muscle, your body still looks like it, because you got to retain some more water, and it just the way the cascade, the way weight works, you're going to put on, you're going to come up, but it's not the same. So you don't get discouraged. You know, you just stick with your program and keep going, because you'll look at the scale and then you'll go from like 196 and then it'll say 189, and you'll realize day to day, the progress might not look how you want it to look, but week to week, the progress will look steady. And month to month, it'll look even steadier, right? But the closer you look at it, the more fluctuation you'll see. So you got to look at it day to day, but week to week, month to month. Like you can't panic. Like we said earlier, when the boxer get hit in the face, they don't panic. So if the scale goes up a few pounds, you can't panic and do nothing dumb and, you know, like, well, I've been having a taste for, you know, I've been having a taste for this ice cream anyway, so I might as well. That ain't how it goes. You get crazy, right? So heart rate's going to go up. Stroke volume, right? Stroke volume's going to go up. Now, this is another reason why you need the vitamin A, right? Because when we're not on our game, right? And kind of like going back to the smoking, because smoke is one of the things that influences this the most, right? Smoke and alcohol. Let me see if this can do it. No, this can't do it. Hold on. I need to find something real quick so I can make this an example.
Myron!
Dude, I can't.
Myron!
What?
What are you doing? What you doing?
What you talking about? What am I doing?
You reading them nasty books again, right, Myron?
Everybody read no nasty books, man. You scared the hell out of me. What you talking about, man? Well, I ain't did that in about 2 weeks. What
You
talking
called yesterday too. What you reading? What you reading?
You scared the goddamn book, man. Dr. Inky. I went on Amazon and got 3 Dr. Inky books because I'm reading about melatonin and biochemistry. Biochemistry.
What is, Myron, that's not even first of all, it's not melatonin and whatever it is that you just said. It's melanin and biochemistry. You can't even pronounce the word, so how you reading? How you reading, Myron?
I'm not looking at the pictures. I got the books right here. I'm looking at the pictures. You know, ain't nothing nasty about this. So what are you talking about? I got all the books right here. What are you talking about?
Myron, you don't even know how to read. Every time we get mail, you bring it to me. You think I don't know that?
I went to I got hooked on Phoenix. Now, what you talking about? I was hooked on Phoenix, so I know how to read.
As a when? Because first of all, hooked on phonics, I believe it's for kids. There's no such thing as hooked on Phoenix. And if I recall, you're the same person that thought reindeer was pronounced reender, and you're the same person that thought pigeon was pronounced piggion. So it makes sense that you went to hooked on Phoenix.
Man, such a dumbass.
No,
Man.
you
always trying to say somebody can't read. I know exactly what I'm talking about, man. I'm reading the book. I got the book. I got the goddamn receipt right here. I got the goddamn receipt right here for the books. What you talking about?
Well, you need to return them for somebody who know how to read them. And I still don't. It's probably all type of stuff in the inside of the books, Myron. That's how sneaky you are. Give me the books. Give me the books, Myron.
Hell no.
Give me the
I
books,
got these off
Myron.
Amazon.
Give me the books, Myron.
I'm not giving you none. I got these books off Amazon. I'm not giving you the books. Ain't that no?
Yeah, well, bye. Bye.
I've been in this game. Yeah, your animals to the shit. Animal, baby.
Okay. So like this, right? These resistance bands, right? This is how your heart material is. This is how your heart muscle is. This is how your arteries are. They like this, right? And a part of your heart has to especially stay elastic, because a part of your heart's ability to eject blood, right, is the snapback, right? The snapback is important, right? So when the blood fills up a compartment, it stretches that compartment. And once it stretches, depending on the amount of blood, there's a snapback to it, right? And that ejects it out. When your heart cells start getting converted into scar tissue and fiber, right? And they lose the elasticness, your heart can't do the slowly but surely, as cells are getting converted into scar tissue and fiber, your heart is hardening and it's losing the ability to pump, and it's losing this elasticness, so it can't snap back. It can't fill up. So over time, you'll start to get leaks in the heart, right? Because when you try to fill it up with more fluid, it doesn't stretch to hold all the fluid. You'll just get runoff, right? And they'll be like, you got leaky heart, so they need to do a surgery or whatever. You know what I'm saying? So keeping your heart flexible is vitamin A. Vitamin A is what stops your heart from turning into fibers, right? It keeps your heart elastic. So hopefully the visuals help get it into your brain, right? But that's what you need vitamin A for. You need it. Vitamin A is more important to your heart than to your eyes, right? Because technically, if your heart is vitamin A deficient, it's going to stop working. Then you're dead. If your eyes are vitamin A deficient, you're just going to go blind. Now, I know that's a hard just, right? But you can still be alive blind. But your heart stopped working, you're dead, right? So again, we don't want to make poverty decisions. You see what I'm saying? I personally want to have enough vitamin A for my eyes and my heart and my liver, because liver needs some. Vitamin A is in high demand, right? So I want to be wealthy on the inside of my body, right? I want all of my tissues to have to I don't want them to be able to, I don't want them robbing Peter to pay Paul. Yeah, I want my tissues to be wealthy. I want my tissues to have enough vitamin A to let somebody else hold something. You know what I'm talking about? yeah. I want my heart cells to have enough vitamin A so that they can let somebody hold something that they needed. Oh, you short this month? Yeah. Oh, you short this cycle? You short this pump? You know what I'm saying? Yeah, hold a little. Yeah, don't even worry about that. You ain't even gotta pay me back. You know, just hold that till you get back on your feet again. Yeah, that's how you gotta think like that. All right. Heart rate, right? Stroke volume. All right, doing the 60 and 60, blah, blah, blah. Blah, blah, blah. Okay. All right. Yeah, this was, so this right here was, this was when we was talking about the Dr. Inky the physical examination that you need to be giving yourself at home. But we're going to skip that for now. All right, we're going to skip that for now. Blah, blah, blah. Your blood is moving faster than the speed of sound. You when you get the book, it's a lot more information inside this book. You know, we don't even have the time to go through everything. Okay, this is how much blood there is in the brain tissue. Let me see where we at inside the book. You take a look. All right, increase capillary growth, water intake. All right, yeah, we can start right there. Yeah, we can start right there. All right. This begins with increased capillary growth and water intake. This is the trick. Now, how much is water? How much does water cost? Right? Little to nothing, right? Little to nothing, right? And they're like, well, no, I got to buy water because I don't drink that tap water. Everybody drinking tap water. Stop it. All right. This begins with increased capillary growth and water intake. This is the trick. Capillary growth means increased blood volume. Increased blood volume means the heart chambers get stretched more. The more they stretch, the stronger they snap back, or stroke volume. Get it? So earlier when we was talking about the stroke volume, right? The amount of blood pumped out with each beat, right? That's based on that elasticness I was showing you, right? And the stroke, typically on average, to have a healthy heart, you need at least 60% stroke volume. That means of the blood that's in the chamber, when it snaps back, at least 60% of the blood shoots out. You know what I'm saying? That means you gotta, your heart is at, you're good. Get less than 60%, you're in trouble, right? And typically, you don't start dropping below 60% until you start building up a lot of fiber tissue in the heart, which comes from vitamin A deficiency, right? All right. Right, so you want to look it up. It's called the Frank-Starling law, right? But when you look it up, it's going to have it may have some slightly complicated math associated with it. Remember, our goal is to simplify, right? So drinking water by itself is a heart exercise, right? I want you to get that. Drinking water by itself is a heart exercise, right? As you grow capillaries, right, you have more room in your circulatory system, right? 60,000 miles is on average. Some people have a lot more than 60,000 miles of vessels. Yeah, some people have a lot more than 60,000 miles of vessels. Some people have 65, 70, 80,000 miles of vessels, right? So, and some people have way less. Some people have, they in trouble. You know what I'm saying? Some people have 40,000, 50,000, you know, they in trouble, right? So 60,000 is that sweet spot where you good, you know what I'm saying? But you can grow more. As you get more capillaries, you have more room for more blood volume, right? As people get bigger muscles, you know what I'm saying? Even people that get fatter, right? They get fatter. Don't see, here's the difference. When you get bigger with muscle, right? The muscle is self-perpetuating, right? So the muscle is going to pump its own blood. When you get fat, fat doesn't pump blood, but it has, you get more capillaries with fat. So as you get fatter, you get more and more capillaries, but the fat tissue is not self-perpetuating. So you put a lot more pressure on your heart and your aorta to circulate blood now through all that fat and blubber. Respectfully. Yeah, respectfully. You know what I'm saying? As respectful as, you know. Yeah, but if you got a whole bunch of blubber and cottage cheese, just know you got capillaries and your body got to pump blood through all that stuff. And every pound, you know, like that's all compact and stress on your heart. That's all compact and stress on your heart. And your heart's probably, you know, getting many heart attacks. You know what I'm saying? This is why I was saying people got troponin levels. People are walking around having miniature silent heart attacks and have high levels of troponin circulating through their body without even knowing it. Troponin is how a doctor could tell if you have heart trauma. You know what I'm saying? Typically, troponin you only have circulating if you have a heart attack. But now people are starting to just have troponin levels floating in their blood, just, you know, just on GP, you know what I'm saying? General purpose, you know what I'm saying? Like it's crazy out here right now. So drinking water grows the volume of water. The more the volume of blood, the more volume of blood, the more you stretch the heart. The more you stretch the heart, the stronger the heart gets. Right? So it actually grows heart muscle, strengthens heart muscle. This is why athletes have larger hearts than regular people, especially out of shape people, right? You are training your myocardium, right? Myocardium. Make your children, your wife, your husband, everybody at home say that word, myocardium, right? And then make your whole family read this book. Make your whole family read this book, right? This is the Ebers Papyrus, Volume 6, right? The Neferland Propulsion Lab Math Edition, right? Okay. All right, total cardiac output. Shu and Nefer, the key to VO2 max. That might be too much to explain to the newbies right now, right? The myocardium, intercostals, and diaphragm with the cardiac plexus are the goals of attenuation, right? The cardiac plexus is a plexus of nerves situated at the base of the heart that innervates the heart. The cardiac plexus is divided into a superficial part, which lies in the concavity of the aortic arch, right? So a part of the cardiac plexus is in the aortic arch, and a deep part between the aortic arch and the trachea, right? So that's kind of Nefer, if you know what Nefer is, the heart and the windpipe, right? The two parts, however, are closely connected. The sympathetic component of the cardiac plexus comes from the cardiac nerves, which originate in the sympathetic trunk. The parasympathetic component of the cardiac plexus originates from the cardiac branches of the vagus nerve. The middle cervical cardiac nerve is the largest of the three cardiac nerves. Now, let me just say this real quick about the vagus nerve. Keep in mind, just always keep in mind that the vagus nerve is one of, the cranial nerves, right? So typically, we don't really think about the cranial nerves coming down into the body and having a bunch to do with the body, right? But the vagus nerve, DTM, the vagus nerve be doing too much. The vagus nerve is all over the place. Just know, right? That's going to become important in the conversations we're going to have coming up, because the next book we got coming out is we're still in our brain series, right? So we did the dementia book, the dope game book, right? And the next book, we're still in the brain. We're still dealing with neurochemistry, right? It's kind of whole body, but we're in the brain still, primarily brain focused, right? Primarily brain focused, right? But I don't want to spoil it for the family. You know what I'm saying? So you'll see it. It'll be ready in a couple of days. You know what I'm saying? What's today? Going on Saturday. So yeah, probably Sunday. It'll be available. Right? Probably Sunday it'll be available. So catch up. If y'all don't got the last few books, you behind. Come on now. You got to go to Amazon, add it to your cart, check out. Listen, we got to get busy with the get busy. Right? Okay. All right, so blah, blah, blah. These are the nerves that, activate the heart, blah, blah, blah. Okay, we can skip there. The better the nerve connectivity to the endothelium, the better the production of nitric oxide production. Okay, so this is doubling down on what I was talking about earlier, right? So the endothelium is the basically like the body of your blood vessels, right? So the blood vessels are made out of muscle, smooth muscle. Those muscles have nerve connections, right? So that's everybody's related, right? Vessels, nerves, nitric oxide. That's how we all related. Right? So the better the nerve connectivity to the endothelium, the better the production of nitric oxide, the better the nerve connectivity to the vessels, the better the blood flow to the nerves. It's a cycle. This is where sexual malfunction meets cardiovascular health, high blood pressure, and nitric oxide. Poor nerve connectivity to the smooth muscles of the vessels causes poor nitric oxide production. Poor nitric oxide production causes vasoconstriction. Vasoconstriction puts more pressure on the heart and walls of the vessels. Telomere loss, more pressure on the walls of the vessels, cause the body to reinforce the walls with plaster, aka calcium, right? Which causes the walls of the vessels to harden, right? So this is the cascade of events that happens that leads you to higher and higher blood pressure. So remember when the doctor was talking earlier, she was like, you got to catch it early to be able to most effectively reverse it, because there's a point where if you catch it too late, you can't really bring the numbers down. And that's because you done got too deep into that cycle, right? You done got too deep into that cycle, and the popular way of thinking about it it's not a natural, it's not a holistic, right? And that's not a knock, it's just different, right? But because it's not the naturopathic or holistic approach, there's variables, right? Remember, we had that variable conversation. You can't have an understanding of medicine or health science without understanding, probabilities, right? That's why we had to have the probability. And just so happens, the probability book is a cardio. Where's the probabilities book? Look at this. Look at this. Look at the cover. Can you see that? Look at the cover of this book, right? This is the probability book. Ma'at, probability and statistics. And what does it say right across the center of that? Cardiochemistry, right? Cardiochemistry, right? But you cannot understand health science or medical science or anything that has to do with your body if you don't understand probabilities, right? Because nobody can speak in exacts when it comes to the body. There's no such thing as exacts. You know what I'm saying? The best doctors in the world are just the best at adding and subtracting the right variables so they can come with the most high probability. You know what I'm saying? But if you want to change outcomes, you have to change variables. And so because the way, popular medicine, and this is why I'm happy for people like Dr. Boz, right? Because the way popular medicine looks at, it's very secular. Just to, shorten, because I'm long-winded. It's just very secular. They have tunnel vision. And so when you do that, you can be very effective at certain things that what you focus on. But if you leave out other variables, you may not be as efficient, or you may not be able to make certain long-term, So these are the things that progress, right? So nerve connectivity and muscle development. These are not even in the realm of a doctor, right? This is the other issue, and maybe this is the larger issue, right? But maybe that's why God sent me, so I could be a prototype. So I could be a prototype for what we need in the future going forward, right? But the way health is institutionalized, right? You have a doctor, right? That doctor has a type, right? So he's either a medical doctor or a surgical doctor, right? So you have a medical doctor for medicine. You have a surgical doctor for surgery, right? Then you have a nutritionist for nutrition, right? Now, where it gets even crazier is, first of all, it's crazy because all these people separate. So that's letting you know that medical doctors is not studying these other things. They're studying medicine. Surgeon, they study in surgery. Nutritionists, they're studying nutrition. But where it gets crazier is they got dietitians. And you're like, wait a minute, hold up. I thought the dietitian was handling nutrition. No. So you got nutritionists, you got a dietitian, then you got a personal trainer, which is an exercise person. So now you got exercise people separate from diet people, separate from nutrition people, separate from medicine people, separate from surgery people. Then you might need to have an herbalist if you want to take herbs. So now you got an herbalist separate from your nutritionist, separate from. So there are things that just aren't even in the purview. So the reason why I like Dr. Boz doing her thing with her million view, is because she's opening up the conversation. You know what I'm saying? It's not going to change overnight, but she's opening up the conversation, because the thing is, smooth muscles and nerve connectivity, doctors ain't on that. That's personal trainers is on that. And personal trainers don't really make money on smooth muscle development. So where personal trainers should be dealing with that, and I know from studying, what was that? I think that was NASM. NASM has a section in their book where they address hypertension. I know that to be a fact, but you're not going to see that personal trainers dealing with that because they don't make no money on that. They make money on selling 6-packs and squats for butt cheeks and, you know, like, so you don't really have that in the purview of medical doctors. So they're not going to really address that part of the muscle, nerve connectivity, motor neuron, like that's personal trainer, and maybe even because personal trainers are, you know, they just focused on their money. That would really be like like a therapist, a physical therapist. A physical therapist is somewhere in between. Like a physical therapist is like a medical grade personal trainer. That's the best way I can explain to you what a physical therapist is. A physical therapist is like a medical grade personal trainer. So physical therapists, they get a little bit deeper, not a little bit, they get a lot deeper into, you know, maybe muscle connectivity and some of the more nuanced aspects. But personal trainers, like if they're NASM licensed, they had to memorize a whole bunch of stuff for tests that they probably just dumped out after they got certified so they could work on flat stomachs and fat butt cheeks. But trust me, they learned some stuff. You know what I'm saying? But yeah, so once the nerve connectivity, the muscle development, and once that starts to get, you know, once those systems stop really functioning efficiently, nitric oxide levels drop. Once nitric oxide levels drop, now you're going to start having more pressure in the system because the vessels is going to be getting tighter and tighter. As the vessels get smaller and smaller, then you're going to have, you know, your body go into like protection mode, and you're going to get more, you know, bone morphogenic protein released into the system so that you get more calcium to deposit into the vessels. The vessels then lose their elasticity because they're getting hard with calcium, right? And so, you know, now you get even more pressure on the system because not only are the nerves and the nitric oxide not there to tell the vessels to open up, but they're not even elastic to stretch on their own. They just like rigid because they turn it into like rock with the calcium. You know what I'm saying? So, then what else you got going on? You know, it's a whole cascade of self-reinforcing negative events, right? So over the years, you just have folks pimping, you know what I'm saying? Like selling drugs, getting money, you know what I'm saying? Like, so they take an aspirin a day. This is directly where the idea that you should be taking an aspirin every day came from. That's how I knew when I first started listening to guys like David Sinclair, I knew he was a fraud. Even though he sounds very impressive because he's articulate and I'm funded by Harvard, and, you know, Bill Gates and Melinda Gates, they funded me to do this. Like, so he throw all these credentials around and, you know, it sound like but as soon as he like, yeah, and so the best thing for people to do is get a lifetime prescription of aspirin and metformin and woo. I was like, what? I was like, yeah, this is the opposite of health. Once you start telling folks they need lifetime drugs, I already know who you with them people, right? So, but this is where the idea of an aspirin a day came in. You know what I'm saying? Blood thinners. Once blood thinners became the standard, that already let you know where the system was geared to. They wasn't trying to fix the vessels. They wasn't trying to open back up circulation, right? They was making your blood thinner so that your blood could fit through the tighter and tighter vessels. The tinier and tinier space, you just thin out the blood and the blood could fit through there for a longer period of time, right? But the problem is, eventually you do have a heart attack, your chances of surviving it is way lower because your vessels and arteries is already hard as hell and thin, right? But then also you allow the person's condition to get worse and worse and worse and worse and worse over time, right? Where you could have just spent that time, money, and energy, like getting the calcium out of the vessels with vitamin K, right? Getting the calcium up out of there, vitamin K, magnesium, right? Getting the nerves and the muscles to start talking and doing their thing again, start communicating, right? Get the MET2, the vessels to start talking, communicating once again, right? Yeah, you know what I'm saying? And get people off of this idea of stronger and stronger blood thinners. You know what I'm saying? That's why they went from just aspirins to warfarin or wayfarin, you know what I'm saying? And, stronger and stronger blood thinners, because the other piece with that is when you thin out the blood, remember the purpose of blood, right? The purpose of blood is to carry stuff. So there's two parts to that, right? You got the hemoglobin, which is carrying oxygen, right? But you also have the flow of blood, right? Which is the flow of blood, which is carrying everything else that's in the blood, right? So blood cells carry oxygen, but the momentum and the magnetism and the momentum of the blood flow is what allows the fats and the proteins and the sugar and everything else that's in the blood to travel where it need to travel. When you thin out the blood, you're literally, it's like traveling on, what's the yellow airplane? Yeah, y'all know who I'm talking about. With the cheap plane tickets. Stripe, it ain't Stripe. I forgot the name of that airplane. The yellow and black airplane people. Yeah, the tickets is cheap, but you can't barely take nothing on the plane with you. Yeah, if you take one bag is like if you take a video camera bag. If you take a handbag, they want $85 for a handbag. If you take an actual suitcase, they want a whole nother $375 for a suitcase. You might as well not even, the discount you saving on the ticket, you might say $50 off the ticket and had to pay another $400 for suitcase. It don't even, you might as well just get Delta or whatever. You might as well just, you might as well just pay for your ticket. That way you can carry your bags with you, you bring what you need to bring. You know what I'm saying? Same thing with your blood. Yeah. Luggage is everything. Luggage is everything. Because that's what's carrying the nutrition from your food, your fats, your proteins, all of that stuff. And as you thin the blood out, you thin out what your blood is carrying. So now your cells, your tissues, glands, organs, your nerves, they're getting less nutrition. So everything has to function less optimally. Everything has to function less optimally because your blood is getting thinned out. So now this is going even beyond whatever the high blood pressure is, right? Because now everything is getting less blood, right? So if it's getting less blood, it's getting less nutrition. Right. So now that's going to seed. That's like planting seeds of destruction. You know what I'm saying? So now that you done cut down, you know what I'm saying? Like Like if you cut, like you got a whole city to manage and you cut everybody's pay at the same time, that city getting ready to erupt. It's getting ready to erupt. In your body, that's going to be called inflammation. You're just going to have pockets of inflammation popping up all over the place that you don't even know why. Yeah, because now you didn't put them cells that live in poverty. Yeah, they back to either or now. They robbing Peter to pay Paul, right? So either I'm going to do this or I'm going to do that. I can't do multiple things because the nutrition ain't coming through, right? So anyway, hopefully we learning something. Spirit. Boom. Come on, Tika. See, you with me. You've been with me the whole time. Shout out to Tika. Tika in the building. Tika in the building. Tika in the building. Oh, and she got the cell up there. Let's go. Let's go. And she put the Zell up there. Let's go. Yeah, nah, them troponins ain't no joke. Smack, you must have looked them up. Yeah, no, them troponins ain't no joke. I'm telling you. Folks is running around. Yeah, but that's, man, I was so mad flying Spirit. Yeah, when I first jumped on a Spirit flight, I thought I came up. You know what I'm saying? Because you know me, I can't go nowhere unless my baby's gone. You know what I'm saying? So it's automatically, Dr. Inky is automatically 6 tickets. So even if I say $50 per ticket, right? Even if I say $50 per ticket, oh, that's a bag right there. $50 per ticket is $300 off for me. You see what I'm saying? $50 off per ticket is $300. So I'm looking at Spirit. I'm like, oh, this is a no-brainer. This is it. Yeah, we flying on Spirit. They're like, nah, you don't want to fly on Spirit. It's less room, less leg room. I'm like, yeah, it's all right. We'll figure it out. We'll just be a little tight. That's all. We learn, if you got a big family, you learn how to be a little tight sometime anyway. So I'm like, yeah, we ain't worried about that. We don't go to sleep on the plane. Yeah, we'll figure that out. You know what I'm saying? Forget about the leg space. Yeah, I wasn't worried about the leg space. But man, we coming with our bags. I got laptop and all that. Woo! And then you cornered, you trapped. You know what I'm saying? You done already got into the airport. You right there at the door. And they're like, yeah, so that bag right there is going to be $45. That bag right there is going to be $85. That bag right there is going to be $125. That bag right there. Oh! No, this is my handbag right here, and this is my carry-on. And we got 6 people, so we got 6 handbags and 6 carry-on. This is how They're like, oh, you never flew Spirit before. Okay, so we don't have that. They're like, yeah, so you ain't got no debit card. Yeah, just let us get the debit. Don't worry about it. We'll fix it up. We'll hook you up. We'll give you a little credit because you ain't know no better. But we're going to have to go ahead and charge you for at least them 6 right there plus 2 or 3 in it. I was like, oh, my goodness. I could have been in first class after I add up all these. Woo! Man. Yeah, man. Once you added up the little bags, and you might as well have been in first class. So anyway. Okay. So we get the cycle, right? It's like a cycle. People go home, some will go in, do a bullet, come back and do the same thing again. All right. So please read and or reread the Osiris Diabetes and Respiration book. Right? The whole book, but specifically pages 34 to 60. Right? Pages 34 through 60. Let's see if we have that book right here on deck. If it's not in here, then we ain't got to worry about it. If it's not in here, then you gotta read it at home. You gotta figure it. Oh no, here it go right here. Whoop. Pages 34 to 60. Okay. This is important, right? Because there's some differences, Black folks, right? So page 34 at the bottom, racial differences in nitric oxide dependent vasorelaxation. Along with the growing heterogeneity of the American population, ethnic racial disparity is becoming a clear health issue in the United States. The awareness of ethnic racial disparities has been growing because of considerable data gathered from recent clinical and epidemiological studies. These studies have highlighted the importance of addressing these differences in the diagnosis and treatment of various diseases, potentially according to race. This is why I'm so pro RFK, right? This is why I'm so pro RFK. It is becoming particularly clear that there is a 2 to 3-fold racial difference in certain cardiovascular diseases, i.e. preeclampsia. If you don't know what preeclampsia is inflammation that pregnant moms get, right? And there's no known cure for it. So if your lady is pregnant, or if you're a lady and you get pregnant and you get preeclampsia, they're going to tell you, like, this how it's going to go. They're going to say, we're going to monitor, we'll monitor it, right? And that's it. When they see it popping up, they just say, we're going to monitor it. Then when the preeclampsia get bad, they're going to tell you, listen, we got to do an emergency C-section. Yeah, we don't have no cure for the only cure of preeclampsia is deliver the baby. So they try to monitor it and, tell you drink a lot of water and hopefully you can ride it out until delivery time. But if not, and the preeclampsia gets too crazy, they have to pull the baby at whatever time it is, right? So this article, right? This article is talking about the racial differences in certain cardiovascular diseases associated specifically with nitric oxide levels, right? So that's why this is important. This whole book, Osiris, Diabetes, and Respiration, I'm telling you, you have to have these books. If you don't have this book, go to Amazon, add this to your cart, check out. Right? But everybody doesn't have the same natural ability to produce nitric oxide. Some of us produce more than others, and some of us produce less than others. Those of us that produce less nitric oxide, we tend to have more cardiovascular problems, right? In this review, the authors summarize the current literature on racial disparities in nitric oxide mediated vasodilation in relation to cardiovascular health, with an emphasis on vascular nitric oxide bioavailability as a balance between production. All right, so we're not going through the whole article, but we do go through the whole article in the book, pages 34, page 60. Right. So yeah, there's that. Right. So there are a lot of different pieces. Right. There's a lot of different pieces to this puzzle. There's a lot of different pieces to this puzzle. Right. All right. So nitric oxide is what keeps the pulmonary membrane from thickening. It keeps the tissues system-wide from thickening. hyperplasia, and blood flow are primary markers of aging. The secondary issues are poor insulin signaling, poor oxygen levels in the extremities, poor nitric oxide, and glycation, which then leads to misfolding tau proteins and amyloid plaque. We could, in fact, call Alzheimer's disease hungry cow, the NVU, or holy cow isn't getting the blood it needs or the glucose it needs. This is only 3 magic ingredients. There is only 3 magic ingredients for this: B3 plus arginine and citrulline, right? Those are the 3 magic ingredients for nitric oxide, right? Vitamin B3 plus arginine and citrulline, right? The enzymatic formation of nitric oxide is catalyzed by nitric oxide synthase through a series of redox reactions. Okay, we might get too crazy. All right, here is the trick. The NRF2 system, what I have been yelling to the world, this is in the power of the monthly detox kit. Optimizing the NRF2 system frees up cysteine. Glutathione is a tripeptide composed of 3 amino acids: cysteine, glutamic acid, and glycine. The synthesis occurs intracellularly. Okay, we're going to get a little too deep into. Okay, all right. The point is, glutathione, right, reverses endothelial dysfunction and improves nitric oxide bioavailability, right? Don't get too deep into the biochemistry, right? And some people are like, no, go through the biochemistry. No. You go to Amazon and get the book, and then you lit, right? But for our purpose, right, the NRF2 system is what replenishes your body's glutathione levels. When you have high glutathione levels, typically you have a high production of nitric oxide. When you have low glutathione levels, typically you have low nitric oxide. Now, how do you get low glutathione levels? Well, when you got a bunch of inflammation, right? When you have a bunch of inflammation, it bombards the NRF2 system. When the NRF2 system is bombarded with inflammation, glutathione levels drop. Right? So this is why we have the monthly detox, so that we can make sure that, your NRF2 system is walking around fully loaded. The NRF2 system is fully loaded. Glutathione is fully loaded. If glutathione is fully loaded, nitric oxide is fully. You see how this is what we do, and I listen to the ancestors, or I should say the elders, just like everybody else did, but I don't know what everybody else is doing, right? But I heard we got to get to the root cause. The root cause just translated to everybody else selling products. I was like, wait, nobody else gonna do this research? Because that's not a root cause right there. Root cause is, so let me show you how root cause works. So here's surface. Here's what's beneath that. Here's what's beneath that. Here's what's beneath that. Here's what's beneath. Can't go any further. Root cause. Can't go any further. Root cause. All right. So nothing's past root. NRF2 system, chicken and the egg. NRF2 system, inflammation. But seeing as in the society we live in, the world we live in, the lives we live, we can't get away from inflammation. What we can do is make sure that our NRF2 systems have more than they need, right? Have more than they need, period. All of the things that they need, we can equip them, make sure they have, like in the war. Typically, the best equipped side of the war is the side that wins, the side that has the most food rations, the side that has the most bullets, bombs, bulletproof vests, walkie-talkie, drone, like the side that's the best equipped typically is going to win the war, right? So if your NRF2 system is the best equipped, if the toxins and the microbes that are causing inflammation are better equipped than your NRF2 system, then, and if you're at home saying, what is the NRF2 system? Clearly you don't have enough Dr. Inky books, because I am the father of the NRF2 system. Yeah, I'm not the father. I'm the godfather. Somebody else discovered it. I'm just the first person to bring it to, social media, internet, holistic community, naturopathic community. Like, it was buried in textbooks. Nobody sought to look for it. The only people that was looking at the NRF2 system was me and the pharmaceutical companies making trillions of dollars, making sure that nobody else ever heard of the NRF2 system. So as long as nobody ever heard of the NRF2 system before, nobody could ever figure out how your cells defend themselves. Yeah. So the monthly detox is like self-defense class for your cells. Yeah. Your cells need either self-defense class or they need a gun. You know what I'm saying? Both of those is inside the monthly detox kit. So without that, Ring doorbell camera ain't gonna get it. Your cells need self-defense training, a little weapon. They need to be out here in these streets, right? So, all right, I think we did a little something. 4.5 hours. I think we did a little something.